afternoon, everyone. Good afternoon, everyone. We will continue our Committee of the Whole budget hearing. Ms. Lawhead, will you please call up the next panel to testify?
We will have Dr. Palak Raval Nelson, Health Commissioner, and we'll also call up Dr. Marquita Williams, Interim Commissioner for DBHIDS.
Good afternoon. Please state your title and please begin your testimony. And for the afternoon session, members, we have the Health Department and the Department of Behavioral Health and Intellectual Disabilities.
Good afternoon, Council President. My name is Dr. Palak Raval Nelson, and I am the Health Commissioner. And I have here with me Ashley Clark Jackson, our Deputy Commissioner / Chief Financial Aid Officer for the Health Department.
Good afternoon, everybody. I am Dr. Marquita Williams, Interim Commissioner for the Department of Behavioral Health and Intellectual Disability Services. And I have with me Deputy Commissioner Dr. Tiara Pritchett and Interim Deputy Commissioner Amanda David.
Thank you very much. And please begin your testimony. Give me 1 second, Council Beatty.
I believe so, yep.
Just wanted to make sure if the two of you could bring your microphones in and speak directly into the microphone.
Is this better, sir?
A little bit, but maybe
Okay.
you have to adjust it up a little bit.
I'll use my outside voice, sir.
There you go. There you
Wonderful.
go. There you go. All right, thank you very much. Please begin your testimony.
Begin?
Either one of you, don't
Got
matter.
it. I'll go first, sir. Good afternoon, President Johnson and members of City Council. I am Dr. Palak Raval Nelson, Health Commissioner. Joining me today are Sarah Ennis Thorpe, Chief of Staff, Ashley Clark Johnson, Chief Financial Officer, Dr. Frank Franklin, Deputy Health Commissioner, and our division directors. I am pleased to provide testimony on the Department of Public Health's fiscal year 2026 operating budget. The proposed FY26 budget will continue to support our mission to protect and promote the health of all Philadelphians and to provide a safety net for our most vulnerable. You have my full written testimony, so I will summarize. The proposed fiscal year 2026 general fund budget totals $161,389,004. It is an increase of $6,186,599 over fiscal year 2025 estimated obligation levels. The increase is due primarily to $6,552,616 funding to support our health center expansion, to increase capacity and provide increased access to health care in Northeast Philadelphia. The department is requesting 1,091 budgeted positions across all funds for FY26, and that is an increase of 9 positions over FY25. The increase is attributed to 1 general fund position, 3 hospital assessment tax-funded positions, and 5 grant-funded positions. The mission of the Philadelphia Department of Public Health is to protect and promote the health of all Philadelphians and to provide a safety net for people who are disproportionately impacted by societal factors that limit their access to health care and other resources necessary for optimum health. We want Philadelphians to thrive, not just survive. Our work activities include our core values are based on our 3 pillars: integrity, commitment, and accountability across the department. Our work activities include providing primary care services to Philadelphians, promoting vaccination for children and adults, preventing the spread of HIV, investigating outbreaks of disease, inspecting restaurants, preventing lead poisoning, combating air pollution, and creating safer air quality, reducing infant and maternal mortality, promoting the health of young children, and preventing heart disease and cancer by promoting healthy eating, physical activity, and smoking cessation. We also work very diligently to control the rat population in the city. Key highlights from this past year include, in 2024, we launched our Philly Joy Bank pilot, designed to improve birth outcomes and support overall well-being of pregnant Philadelphians. We have enrolled 250 participants and families. We are continuing our work on injury and violence prevention using evidence-based approaches with youth-serving organizations. We are also working with other city departments on the Mayor's Vision Zero goals. And many of our divisions, including the Division of Disease Control, Air Management Services, Environmental Health Services, and our Public Health Lab are preparing for the special events and festivities that are coming up later this summer and in 2026. These divisions ensure proactive prevention of diseases so that everyone can enjoy the festivities and be safe. We have a robust infrastructure with years of experience from our work during the papal visit, the DNC, and other such activities. Our Division of HIV Health has been assisting with transitional housing for people living with HIV. We have also received additional funding to help with our lead hazard remediation in homes where children have been lead poisoned. Our Air Management Services Division has implemented a training program for scrapyard operators working with licenses and inspections to prevent fires. Our Medical Examiner's Office has been working on conducting advanced DNA testing to help identify next of kin for long-term unidentified decedents. Our Ambulatory Health Services Division has been continuing to add capacity and services within AHS operations and continuing the improvement of our existing health center facilities. Lastly, our core admin services have been diligently working towards filling vacancies, conforming contracts, procuring needed items, and making sure that our health department facilities are in good repair for all Philadelphians. I thank you, Council President and members of Council, for your continued support of the Public Health Department, and I am happy to answer any of your questions at this time. Thank you.
Thank you very much. Dr. Marquita,
Thank
please
you.
begin your testimony.
Thank you very much. Good afternoon again, President Johnson and members of City Council. I am Dr. Marquita Williams, Interim Commissioner of the Department of Behavioral Health and Intellectual Disability Services. Joining me today are Dr. Tiara Pritchett, Deputy Commissioner, who oversees the Division of Administration, Finance, and Quality, and Amanda David, who oversees the Behavioral Health Division. I am pleased to provide the testimony for DBHIDS's fiscal year 2026 budget. In April of 2024, I became the Interim Commissioner for DBHIDS. My work with the department spans over 13 years, and I have had the privilege of serving in various roles throughout my time. I give you this context because I have seen the tremendous work that DBHIDS has done over the years to evolve the behavioral health landscape in Philadelphia into a model behavioral health system across the country. I wanted to take this opportunity to say how proud I am to have worked alongside and now lead my fellow colleagues in work that they are personally committed to and invested in. We are together a strong DBHIDS. You've been provided with our full testimony, so today I will highlight our 2025 updates on the transformation of our crisis system, the expansion of our provider network to diversify and include more providers of diverse backgrounds, the partnerships that we have with other city agencies to serve the city's most vulnerable residents, and finally, how DBHIDS is supporting the mayor's vision of a safer, cleaner, and greener Philadelphia with access to economic opportunities for all. The DBHIDS mobile crisis teams include 4 providers: Elwyn, PATH, the Consortium, and JFK. These providers manage up to 29 adult community mobile crisis response teams 24 hours per day, 7 days per week across Philadelphia. Each provider is responsible for a geographic region, and their work is to respond and deliver immediate support in communities for individuals experiencing a mental health crisis. This critical resource has helped to reduce the need for law enforcement involvement when an individual is having a behavioral health-related crisis. Between January 2023 and February 2025, approximately 14,793 dispatches were recorded, and that number continues to grow. A significant part of our crisis system capacity building effort was the expansion of our Philadelphia Crisis Line. DBHIDS has expanded the PCL staffing to meet the anticipated needs of the 988 hotline. PCL now handles about 6,000 calls per month, providing telephonic crisis intervention, clinical consultation, and seamless dispatch of mobile crisis teams when a person is in need of support. Additionally, the collaboration between 988 and 911, which co-locates 988 counselors in the 911 radio room, has led to a 36% increase in warm transfers of behavioral health calls from 911 to 988 during the same period mentioned. This ensures that individuals in crisis receive the appropriate mental health services swiftly and effectively. In January 2023 through February 2025, 4,288 calls has been transferred from 911 to 988. In September of 2024, we also established the city's first adult behavioral health urgent care center, located at 3125 North Broad. In the first 5 months of operation, between September 2024 and January 2025, the Behavioral Health Urgent Care Center conducted 1,113 service encounters, reducing the need for more acute crisis intervention. Overall, we understand that meeting the needs of people in crises across the city must be coordinated strategically and effectively to continue to save lives. In terms of our providers' connectedness, related to identifying key areas of high need, the department has proactively sought to include providers of diverse backgrounds to ensure that the options of service for people seeking our help is representative of them and their communities. This work specifically evolved from our efforts to address and support youth living in areas of the city heavily impacted by gun violence. So in late 2023, we convened 17 organizations working on the front lines of violence prevention and mental health services in their communities. Many of these organizations provide both traditional and non-traditional interventions that meet people at the level of their need and help to transform the experience of the people that they serve. Currently, these providers continue to meet bi-monthly with DBHIDS and the CBH leadership and are able to present various culturally informed models and are helping to recreate new programming and barrier-free access to our service system. Additionally, over the last 2 years, CBH increased access for care for members by opening the provider network for the first time in 14 years. This action allowed for more Medicaid licensed providers for services to Philadelphians in need. We see this as an important step in ensuring that our network truly reflects the diversity of Philadelphians' needs and the individuals we serve. In terms of our partnerships with other city departments, DBHIDS partners with multiple agencies and departments across the city of Philadelphia, including, but not limited to, the Office of Homeless Services, the Philadelphia Housing Authority, the Philadelphia Department of Public Health, the Philadelphia Police Department, the Streets Department, the Department of Human Services, Parks and Rec, the Managing Director's Office, and several others. Also with local hospitals and programming to serve the city's most vulnerable residents experiencing homelessness and whose lives and families are impacted by a variety of behavioral health challenges. In FY24, DBHIDS's homeless outreach team engaged over 9,200 unique individuals living on the street across the city. Homeless Outreach worked tirelessly and made 38,594 contacts with these 9,200 individuals, working to build lasting relationships to facilitate placement acceptance. Their efforts resulted in 2,464 unique individuals, or 23%, accepting housing and/or behavioral health treatments. The DBHIDS Mobile Outreach and Recovery Resources team supports the city's neighborhood wellness courts and other court systems. The Moore's CDC program provides case management to our neighbors in need and helps to increase adherence to substance use treatment, and the recovery supports continuum of care. In addition, our Behavioral Health and Justice Division is a crucial tool in our service delivery system. It serves as a centralized referral system for justice partners, including the District Attorney's Office, the Defenders Association, and the First Judicial Court District. Our justice partners are able to make referrals for individuals they think would benefit from connection to behavioral health treatment and social determinants of health resources. BHJD navigators screen and assess the needs of individuals referred and ensure appropriate referrals are made to available resources. This portal plays a significant role in ensuring that individuals in need are connected to the right services at the right time. Approximately 500 referrals are made through the portal annually. Our behavioral health system also works in partnership with the School District of Philadelphia by supporting children in schools and in their homes. Services include SAP programs, which are provided in every district operated charter and parochial school across the city, and a host of prevention programs addressing mental health and substance use disorders, such as a number of programming, Girls Circles, Too Good for Drugs, and A Positive Turn. Lastly, our work supporting Mayor Parker's priority of creating a safer Philadelphia. Our outreach teams are on the street every day, engaging people with mental health and substance use disorders. Our community wellness engagement teams meets with community members and businesses to educate and support their connection to services for themselves and their communities. Our Network of Neighbors teams meet with communities impacted by violence to connect them to the services that mitigate the impacts of these traumas. Our Trauma to Triumph program seeks to break the cycle of violence that have trauma as their root cause. DBH partners across city departments and with a number of community-based organizations and providers to implement the behavioral health services and programs across the complete wellness ecosystem. In conclusion, DBHIDS plans to continue these initiatives in fiscal year 2026. We are firmly invested in bettering our best every day. The support of City Council has been crucial in helping to address the profound challenges to behavioral wellness and the trauma that has so widely impacted Philadelphians. We appreciate the opportunity to highlight the work of DBHIDS, and my colleagues and I are ready to respond to questions that you may have. Thank you so much for your support.
Thank you, and thank you, Dr. Williams, for your hard work. And I appreciate you taking on the role as interim director, although I would push you to be permanent, you know, if that would be something that would be in your vision. But nevertheless, we appreciate the hard work that you have been doing. and I know the mayor and her team are listening, and so, yeah, I think you should make a permit. And so,
Thank you so very
I thank
much.
you for your
Thank you.
passion. I thank you for your commitment, and also, you always just been on the case. I know you've been walking me through the process of the possibility of bringing virtual trauma support to our young people and showing me the ins and outs of that process, but most importantly, just staying on the case. And so just want to personally thank you for that. And also LaVan White, also for being a liaison and talking to members of council and keeping us abreast on all the great things that your department is doing. And so I wanted to take a moment to ask a couple questions, first starting with Dr. Nelson. And Dr. Nelson, you're new to your position, and thank you for stepping up to the plate and taking helm of an organization that's critically important when it comes to health equity in the city of Philadelphia. And I know during COVID, if we've learned anything regarding the inequality of how health support is throughout the city of Philadelphia, that definitely showed us that we need to make sure that we're keeping health equity as a #1 priority, so also thank you. Quick question though, and so, and just going over a variety of different things that was mentioned, Dr. Nelson, in your presentation, we talk about air quality, for environmental equity, health infrastructure, public health planning and events, federal policy and funding changes, community safety and business regulation, maternal and infant health, access to health centers, child-led exposure, substance use prevention, harm reduction. And I wanted to get an idea. I worked with Dr. Ruth Abaya in the past regarding the issue of gun violence, and also with my colleague, Councilman Jamie Gauthier, and we came up with the injury prevention dashboard. That's what we fought for as one of our budget priorities. And although we had a historical low when it comes to gun violence and homicides, but we still saw an increase in juveniles being arrested and prosecuted as adults for gun violence. And we want to continue the mission of addressing gun violence as a public health epidemic as we have in the past administration, and just wondering what is this administration's position, because based upon your testimony, we're not talking about gun violence. We're not talking about gun violence as a public health epidemic. And so just giving us an idea from your perspective where we're at, what's your agenda. We work with a coalition of different hospitals, such as Temple, such as CHOP, such as Drexel, particularly around gun violence. I want to see where your agenda is, since it's not mentioned, or the administration's agenda, since it's not mentioned in your testimony.
Sure, Council Member. So while I've been Health Commissioner for about 4 months now, I have been with the department for 29 years, and our gun violence injury prevention work, it's folded within our Division of Chronic Disease and Injury Prevention. While Dr. Ruth Abaya has moved on to other positions, we're still continuing that work within our chronic disease and injury prevention, and looking at, we're also working with the Office of ORU and Adam Gear's group on different facets of how we can support the work that's being done, along with working with Dr. Williams and the mayor's focused on breaking down silos, having been in city government for 29 years and worked with folks side by side. It makes it a lot easier to reach across to another department and say, hey, this is the work that we're doing. How do we continue this work and move it forward? So we are in the process of setting up some additional meetings and kind of getting a sense of what are the activities that we need to launch out, especially we know during the summer months things get escalated.
So I'm gonna give you some grace because you just got used to how many months?
4 months.
4 months, okay, all right. All right, well, I will at some point in time in the future want to get a more thorough idea on where your team
Absolutely.
is at, specifically around gun violence, shootings, homicide, addressing the issue of trauma, right, and making sure we continue to address gun violence as a public safety health epidemic. And even though I know you're just there at 4 months, right, but you've been there in that position for how many years?
I started off as a health inspector, so I came up the ranks. So I've been
Yes.
here. But we'll get you a full answer of the work that we're doing in terms of
Because
that.
everything else is mentioned in your testimony, but gun violence as a health epidemic or any work related to gun violence. And so it's glaring just based upon the work that this body has done. And normally when the health department is in front of us, we get a chance to address that particular type of issue. And so that's all.
We'll get you a full answer, sir.
Okay, and we're partners in this, and
Yep.
so however we can be supportive, that's how we work as a unit, particularly with Councilman Jamie Gauthier and myself around this particular topic of gun violence. Thank you. So who's going to be leading this session? Is Councilwoman, the Chair of Health, Councilwoman Dr. Nina Ahmad, but I'm going to just use a moment of personal privilege because she has to leave immediately after she asks her question is Minority Leader Kendra Brooks, and then I'm going to divert the rest of this conversation through the Chair of Health, which is Councilwoman Dr. Nina Ahmad. The Chair recognizes, she's not here? Oh, okay. Oh, well. The Chair recognizes Councilwoman Dr. Nina Ahmad.
Council President, thank you all for being here and for doing so much important and critical work for the well-being of Philadelphians. You know, if we are not healthy, we can't do anything else. Whether it's, and health is an intersection of many things: mental health, physical health, financial stability, food security, housing, environmental justice. All of these things contribute to our health. But I wanted to focus in on something that was mentioned around the Joy Bank. You know, you said you had 250 participants in the Joy Bank. Could you elaborate more on what your findings are, whether this was a successful pilot, what the plans are for doing more than those 3 zip codes? Do we have resources to do that? And what is the fundamental finding around implicit bias and maternal care that you might have discovered through this process?
Sure. So, Council Member, the Philly Joy Bank began last year in 2024 in the summer, and we have since that time enrolled 250 individuals. However, we're not quite at the place or moment to fully evaluate yet. It's not been enough time, but we are working on the evaluation plan and can absolutely share the results once the evaluation is completed. We haven't quite reached a full annual cycle.
Any highlights you can share before we go to the actual formal report? Because I keep talking about the Joy Bank, and I don't have any data to sort of underpin what I'm saying. So I would love to hear this, even if it's at this moment anecdotal from your perspective, because there's a whole conversation about how we work in human services, serving communities who are but for poverty, great families, but that has become an issue in how we do child removal. So is there extrapolation of sort of what the Joy Bank finds? Can we do something similar in some other areas? Which is why I'm so interested if you can share any highlight, which we won't hold you to till the final report is out.
Absolutely. Well, I know one of the highlights that is up and coming is we're going to have the celebration for the first year of the program completion. So that is a big highlight. I think the other major highlight to think about is the fact that we actually have, when have you heard a program that gets initiated and within not even a full 12 months, we have 250 participants already enrolled and within the program. So those are definitely on the preliminary major highlights. There are so many times public health programs that get put in place and then you don't have participation and you don't have active participation. So we have full-on active participation and we can get you some additional details.
That would be great. My next question quickly is about vaccinations. The testimony did not explicitly mention vaccinations, but we know that the department has a focus on infectious diseases like measles, H5N1. Could you elaborate on vaccination initiatives that DPH is planning for 2026 to prevent these and other diseases? I am particularly concerned about the a drop in childhood immunizations, and I would like you to comment on the target rate and where are we in Philadelphia?
Sure. So first and foremost, there's no drop in immunization rates for our city. We're still staying steady at our high vaccination rates, and we are continuing to do our work through our health centers and also partnering with other local jurisdictions, the School District of Philadelphia and others to get as many children and adults as vaccinated as possible.
So we're reaching our target rates as we did in the previous year?
Yes.
Is there overall reduce in rate for the region, Southeast Pennsylvania, which will of course impact us because there are no real borders for viruses?
One more time, can you repeat
So
the
is there
question?
any difference in the target vaccination rate for surrounding counties, not necessarily Philadelphia, that you're aware of?
So in order to determine where we are in terms compared to other surrounding counties, we will have to go ahead and get those results back over to you because that is a fairly complicated question, and we need to go ahead and work with the state health department to get
Only because we know nationally it has dropped.
Yes.
That is a fact. Obviously, I would like to know how well prepared we are, even if right now we're seeing not an impact, because it'll be impacted by people around us in different counties.
Our rates haven't dropped, council member, and we're staying steady and we're continuing the work that we have been doing.
Can you just tell us what are the initiatives you take normally for vaccination rates to stay where they are? What was your general practice?
So generally, we work on vaccinations through our health centers. We also inform pediatric providers about the various needs of vaccinations. Most recently, the Children's Hospital of Philadelphia wants to do an event or to get more folks vaccinated in the lower northeast area with our various populations. So we're partnering with all of the folks that we possibly can to get the additional vaccinations done. And we have our Vaccine for Children program that we've continued, and we will continue to work on that.
The reason why I'm on this issue of vaccinations, we're going to have a huge influx of visitors coming next year. And so I just wanted to know, how are we prepared for folks? We have no idea what their status is, vaccination status is, and what can we anticipate to make sure Philadelphians stay safe, at least on this front?
Sure. So, we can have Jessica Kalm, our division director for disease control, come up and talk. But I just want to say one thing before she comes up, and that is, our children are vaccinated and they'll be vaccinated at the same rate. I understand the concern about, folks coming to visit us from all over the place. And while we may not know their vaccination status, our best defense is our offense of getting our folks vaccinated and making sure that vaccines are available for all of the folks that need the vaccinations.
Okay. Well, is she going to come up and tell us? Okay.
Good afternoon. I just wanted to address the question about preparedness for next summer's events. So we have convened internally several of our divisions to start planning. We have also convened a regional surveillance group where we are working with surrounding jurisdictions and the state of New Jersey to prepare for the events of next summer. And this surveillance group in particular will be working on identifying all of the diseases that may be occurring in the countries where we expect to have visitors. And we'll be notifying all the healthcare providers in our city to let them know about things that they should be aware of with respect to clinical presentation for various illnesses that may be happening at that time. I think we can anticipate now some things we might see, and certainly measles is something that we would want to be prepared for, but we'll also need to see what other outbreaks may be happening next year in order to notify healthcare providers. So we will notify them through something called the Health Alert Network, so the HAN, which is a national system, and we have a local system as well. So we will notify all of those providers again about what to be on the lookout for. We will provide additional tools that they can use to make sure that if anyone is presenting to local emergency departments, that those providers are aware and have guidance as to how to manage them. And we're working, part of our participation in the surveillance group is with representation from our hospitals through the Healthcare Coalition.
Well, thank you. I know the bell rang. Just last one question around communicating this plan and this sort of preemptive move to our communities. People are not following all your surveillance methods. So I just wanted to know, what is the community outreach program underway, amongst maybe other things, that you're telling people about the importance of vaccination and at the same time saying, we are ready, prepared, because this gives confidence in Philadelphia.
Right.
And we want our communities to feel that.
Well, we have a few mechanisms for communicating with our communities. One in our Division of Disease Control is something called the Community Response Partner Network, which is a listserv of hundreds of community-based organizations who we send regular newsletters to, regular communications out to make them aware of things that they should be on the lookout for. So most recently, we have sent communications out regarding measles, as we have had a couple of cases occurring and have done a lot of work in order to contain transmission of those cases. That's a network that we will use next summer to alert all of our communities about activities that will be happening and things that they should be aware of. We also have mechanisms to do neighborhood canvassing, as well as canvassing of early childhood education centers, community organizations, and one area that we have also looked at and have been working on actively, especially with respect to measles, has been urgent cares. They are not traditionally folded into all of the other communication networks, and so we actually will send staff out to the urgent care networks across the city to provide materials and make sure that they are also well prepared to recognize any diseases of concern that may present in those locations.
Council President, I'll have my second round for Dr. Marquita Williams. I didn't get to that at all, so thank you for giving me so much time.
Thank you. And at some point in time, I'm sure you're going to talk about vaping,
Yes.
and popcorn lungs.
Yes,
and
we're
things.
talking to them all the time right now, so
Okay. All right.
we should be putting our hearing back.
All right, I'm going to stay in my
recontinue.
lane, but I do want to hear more about the popcorn lungs and
I can do that now if you
devastation of
if you want to
vaping.
indulge me now. Okay. So yes, should I go ahead? Okay. As
Member Young.
you know, your department has been working very closely with my office to talk about the bill we have underway to increase fines for retailers who violate selling vaping products and other tobacco products to our youth under 21. And I wanted to kind of look at why we are doing this from a medical perspective, the idea about this irreversible popcorn lung situation that occurs in young people, and how serious it is, because the hearing we had really had young people come to us and tell us, you have to do something. And this is our response to their requests, because they're watching their peers really get impacted. And if you could speak to the addictiveness of these vaping products, because these are pure nicotine versus what we got in a tobacco form, smoking cigarettes, and where the health department is on this matter, because we continue to see huge targeting of young people, particularly in underserved, under-resourced communities, and they're taking advantage of that.
Absolutely. So, for the record, tobacco and nicotine specifically, there's a warning label that says, if you use this, it's going to kill you. And the tobacco industry has been very stealthy in the way that they do advertising. So as cigarette smoke and cigar smoke and other things started becoming less in vogue, they started doing vaping. As they had issues and court cases that they lost associated with tobacco products, they started doing vaping. Vaping and Juuls are not necessarily as heavily regulated as tobacco products. For us at the health department, and the tobacco industry traditionally hooks people while they're young. Okay, so if I think back to my youth, the going ad then was, you've come a long way, baby, with Virginia Slims, right? Making it look very attractive, very the in thing. Now the newest thing are the Juul products. So as the health department, we have to be committed to we can prevent people from getting hooked, from our youth from dying, our youth from getting chronic diseases. So we are working not only with your office, we have 2 divisions within our department that handle specifics with tobacco and vaping and JUUL regulations and everything. Our Chronic Disease and Injury Prevention Division and our Environmental Health Services Division, which is our enforcement arm that goes out. We've worked with the law department. We're able to do everything from issuing code violation notices, which are tickets, to doing cease operations if folks are selling to youth, to closing businesses down for 14 days if they've had infractions multiple times. So we are committed to doing this work and working with the youth. We have funding from the JUUL settlement, and we are working to increase with finance to increase the media campaigns and to do the there was a lot of truth. I don't know if anybody remembers those ads, the Truth About Tobacco ads that were in place about maybe 8 or 9 years ago that were very effective to prevent youth from doing smoking cigarettes. So our goal is to use part of the settlement dollars towards advertising, education, and then also the enforcement work that we need to.
Are you keeping track of any data that shows whether the usage has, what the rate looks like, where they're happening most? I know you have heat maps and all. Can you just tell us, for the record, where do you see the most unauthorized sales or illegal sales happening in the city of Philadelphia?
So, council member, that's very challenging to answer, only because there's about 2,500 or so places that have a tobacco permit in the city, right? We have no way of capturing those folks that sell tobacco products that don't have a permit, and they're just selling because they're just selling. We have no way of knowing that.
The pop-up shops.
Correct,
Yeah.
correct. And so it's like any other activity. People can, we have no way of knowing how many people sell water bottles during a hot summer day on the street because they're not a regulated entity. They're not permitted, they're not licensed. But for the establishments that are permitted, we do inspect them. They get, annual inspections.
Yeah.
We work with the law department as well as licenses and inspections.
So, Mike, I think you articulated the problem. We don't know what we don't know, and how can we address that along with our law enforcement, along with LNI, maybe region by region? We have a sense of where they are most in Philadelphia. It's not all over. It's not in Chestnut Hill. It's not in, Old City. It is in specific regions. We know what those zip codes are. So since we know that, what is our targeted way of addressing so those children know that we love them? Because we are putting resources, we are stopping those smoke shops, we are holding people accountable, because that's what the children of Philadelphia told us to do. And I just wanted to know, how are we going to get there? It's not impossible. If we can go to the moon and we have all these people coming and going, we can know where these smoke shops are, and we can have a much more proactive program to address that. So I would like to know what we are doing from multiple, not just the health, but maybe health coordinates that. What is our effort to really crack down on that?
Sure. And council member, I'm a firm believer the word impossible is broken down to I am possible. So anything is probable and possible. And so what we are doing is we receive complaints, right? A lot of these illegal shops are on a complaint basis. So because we have partnered with and have been working with the Mayor's Nuisance Task Force, and we work with LNI, the PPD. We work, if there's alcohol involved, we work with liquor control enforcement and everything. And there are monthly meetings. In the interim, we do conduct joint inspections. Different departments have different authority, and so we work together collaboratively, and our staff go out in the field with their staff, the different department staff, and we conduct inspections, and when we see evidence, because we need to see evidence of it, we take the appropriate enforcement activity, which is whether that's cease operating the establishment. If there's other behavior happening, PPD goes with us and addresses that as well. So those are the sorts of activities that we're engaged in, and we are tracking those activities through the nuisance Philly Stat 360.
Okay. So we have data around it
Yes.
over a period of time. Could you please share that with Council President to
Sure.
show these concerted, coordinated efforts have resulted in X? I would like to know that, to know our tax dollars are being used to protect our children.
Sure.
All right, thank you. Thank you, Chair. I'll reserve my questions for Dr. Marquita for the next round.
Thank you. Thank you, Chairwoman. Chair recognizes Councilmember Harity, followed by Councilmember O'Rourke.
Thank you, thank you, thank you. Thank you guys for coming in today. First off, thank you for the work you do. This is, the work you guys do is for our most vulnerable population, and it doesn't escape us here in City Council. We have a big respect for the work you guys do. That being said, this week the Inquirer reported this week that Judge Simmons was ready to shut down the program over frustrations with the lack of coordination and communications from the administration. The administration says the changes and delays were due to administrative protocols that we need to be resolved. In your opinion, what is the biggest obstacle in streamlining the process to get people into the Wellness Center program? You know, we're all committed to this work, and especially us in the Kensington caucus. For us, it's about getting people into this wellness ecosystem and giving them a chance to succeed. What are your views so far? Because you guys are working as part of that, correct?
Yes, we are working as a part of that team.
Correct. So what do you see as an obstacle or something that we can do to streamline the process? Because in reality, it's about getting people into recovery, and the easier we can make that, the more people we'll have that will succeed. So just trying to see if you guys had any wishes or, you know, or what you have seen so far that we can rectify. You know, administrative stuff, that's stuff that we can fix that.
You know, I think anytime that there is a new initiative in the pilot phase, those initial months of all the teams working together, this is an initiative that's led by Public Safety, Managing Director's Office, inclusive of partners like DBHIDS. I think that, I really think it's the time that it takes to bring a pilot to full bloom and to make sure that we are addressing all of the kinks as they come. That's the stage that we're in, right? I think that it's really sort of like the par for the course in terms of implementing new programming. And I think that if everybody continues to come to the table and work together to make sure that there aren't these barriers to people being able to come into court and then move from that court process into treatment, if that's what's indicated, you know, sort of that's what it will become, and we'll be able to scale it up for 5 days.
Yeah, we're looking forward to scaling it up to 5 days. All right, right now that's all I have, and again I thank you for all the work you're doing. Look forward to working with you to get this situation moving in the right direction. But I really do feel that this wellness village is one of a kind, and
it is.
that once we work the kinks out, this is going to help a lot of people and give a lot of people the opportunity that they wouldn't have normally had. Again, always talking about people, places, and things for us addicts is what helps, you know, is what hurts us. So by not having to go back to the place we came from right away, gives us more time to be able to deal with the realities of being sober. So I thank you for your work.
Absolutely. Thank you so much for all of your support. I mean, if you look back in history at programs that where these revolutionary state-of-the-art programs, it takes time to sort of, move outside of maybe some of our traditional ways of being, to implement new ideas, to get everybody on the same page and to make it work for the outcomes of everybody involved. So I think you're absolutely right, and we're committed to continuing to support the administration as well as all of the individuals in council to make sure that people have what they need when they need it. So thank you for your support.
Thank you.
Chair recognizes Councilmember O'Rourke, followed by Councilmember Lozada.
Thank you, Mr. Chair. Thank you all for being here. Good afternoon. The services that you provide are critical to ensuring access to care for Philadelphia's most vulnerable residents, including the uninsured, including the undocumented, including the poor. Given the looming federal threats to Medicaid and to SAMHSA funding, I'm deeply concerned about the impact on health care access in our city. Dr. Williams and Dr. Raval Nelson, have your departments engaged in any scenario planning or financial modeling to assess the potential impact of these cuts?
So absolutely, that's one of the things that keeps us up, right? Because we know that 40% of Philadelphians, around 600,000 people, are eligible for Medicaid here, and potential cuts could be catastrophic for us. And so we have been doing continuity planning, looking at if there is a cut, where potentially would that cut come from? What are the services that would be impacted? What would access look like for those individuals, families, children, whole communities, if that was to happen? And then looking at our provider network to see now, where are there places that we can think about cost saving, cost sharing, constriction of the network in anticipation of something happening that obviously none of us want to happen,
right,
but in an effort towards thinking it through in the event that there are some cuts. And so we've done that internally, but we've also started talking to our provider network about it. And in fact, later on this month, we're supposed to go back to the provider network to include them
Excuse me,
in
I'm
some of
sorry.
the planning.
Can you
Oh,
do
I'm
me
sorry.
a favor?
To include them
so
in
this
some
is,
of the planning.
in two things. Number one, can you make sure that you're speaking into the mic so the stenographer can hear?
Yes.
But number two, can you be a little more concise in your answers? Because the
Absolutely.
councilman has a limited amount of time, and so do the other members, and they really want to get a lot of their questions in, and we're already at past our time. So
Thank you very
Thank you
much.
so
I
much.
will keep that in mind. Thank you.
What you shared is actually good to hear. Could you talk more about which services in particular would be at risk under the most likely cut scenarios, and from what you know already, and then which communities would be most impacted? And I'd also appreciate if you could forward information about the planning that you guys have been able to compile heretofore, and it just sounds like you have some more to do.
Councilman, I'm gonna give you another minute, because I know I interrupted and some things weren't actually heard on the record, so we're gonna give you a little more time.
Thank
Sorry
you,
about
Mr.
that,
Chair,
Councilman.
for your indulgence.
Councilman,
If you could forward the information about the planning to the Council President at your earliest convenience, that'd be super helpful as well.
Absolutely, we can do that. Thank you. And can you repeat the last part of your question?
Yes, if you could pinpoint like the communities that are impacted. If you, we would like to talk more about which services are actually at risk as a result of these cuts, and then which communities would be most impacted.
Got it.
In particular. That would be good for us to know
Absolutely.
in terms of what you all are seeing coming down the pike.
Absolutely, thank you. We can get that to the Council President's office.
Okay, all right, that'd be super helpful. I'll try to get one on and then pass on the mic for public health. So last year, our office and many advocates raised concern over the Parker administration's announcement that they would not include any funding for syringe exchange programs in their FY25 budget. The council passed a budget that reduced funding for syringe exchange programs by nearly $1 million, and many healthcare experts said that Philadelphia should brace for, quote, a spike in HIV and other bloodborne diseases. A couple of questions. Has the department tracked any changes in rates of HIV, of hepatitis C, or other bloodborne illnesses since the funding cuts took effect? If so, what are the trends? And are you aware of whether the organizations previously funded to oversee syringe exchange programs were actually able to identify alternate funding sources? You may not know that, but I wanted to ask.
Sure. So the funding was shifted away from the harm reduction section of syringe exchange, and our Division of HIV Health, as well as our divisions of disease control and prevention, we've been monitoring the number. We have been keeping track, and we can get you a full update about where where we are with the HIV data.
You don't have any of that on hand at the moment?
What's that?
You don't have any of that data on hand at the moment?
I can look through our division of,
Okay.
our budget was changed around a little bit, the time frame. So
Gotcha.
our HIV director is not here today, but I can absolutely get you that in a few minutes. The rates have not spiked as we had anticipated. They have not. But we are keeping a close look at it. One of the reasons for that is that we've been focused on other upstream solutions. So what can we do in terms of PrEP and other sorts of solutions to prevent the infections from happening?
Thank you, Doctor. I heard the bell, and I thank you for your indulgence, Mr. Chair. I'll come back around for second round.
Thank you, colleague, and I too look forward to that data to see if if we've seen any spikes or anything of that capacity. Chair recognizes Councilmember Lozada, followed by Councilmember Gilmore Richardson, and then Councilmember Gaudier.
Thank you, Council President. Thank you both for being with us. First, I want to make sure that I extend my gratitude to Commissioner Ravel-Nelson and Sarah for always being present in the 7th Council District. We had quite a ride at the beginning when I first arrived here, and we were trying to talk about the need for more health centers. And that still hasn't changed, right? We're still having those conversations, and we still have the need. I just want you to, for the record, to talk about the importance of the new health center that we are looking to see happen at Frankfurt Transportation Center. What are some of the challenges that we're still experiencing? And do you see this project as a project that will continue to be a priority, not just for council and the residents, but for the city and the administration?
Sure. So we know, based on the population and the demographics of the Northeast, we know that in the city of Philadelphia, and I'm going to try to keep it brief, but get it on the record, of all of the health centers, we have 8 health centers, though the numbers are a little bizarro, but we have 8 centers. We have 1 health center that is on Cottman Avenue that serves the entire Northeast. The average wait time for a child is 6 months for an appointment, and the adult wait time is over a year. So the Northeast is a healthcare desert, and the population is as such that they don't have the capacity to go all over the city to seek care. So it is definitely a need. We are working, as the council member is aware, to get the legal documents in place to move forward with the design phases and of the health centers.
Thank you. And then you just mentioned that the spread of HIV did not change or did not go up as a result of the changes that this administration has made. Can you tell me what we are going to continue to do to ensure that the population that desperately needs those services continues to receive them while still responding to the quality of life in the neighborhood of Kensington-Harrogate? So we are going to continue to do all of the outreach and the work that we do, whether it's with our partners at DBHIDS, our division of our super division, which is the substance abuse division, whether it's our disease control folks that go out to do vaccinations on foot. So we're going to continue to do all of that work. Our division of HIV health is working collaboratively with our super division to monitor the rates of HIV, and they're putting together a process plan for, as I mentioned, upstream solutions so that we can continue to keep an eye on that rate so that that level of disease does not go up. We're also working with when and where, when we're asked, to work with philanthropy, as the mayor had charged us to work, to raise funds for other sources of harm reduction. I'm sure that you've heard that there are some different feelings about coordinated mobile provider services in districts like mine. Do you see us experiencing challenges or putting individuals at risk that need mobile services by us coordinating the efforts to ensure that the most vulnerable population gets the services that they need while responding to the quality of life that we have heard has gotten worse since we've allowed services just to happen anywhere?
So I know that we've been working for several months now with your office and other departments, as well as the managing director's office and the mayor's office, to come up with legislation that would be effective in the implementation. And I believe that, we're getting there, we're approaching that. We have carved out the things that I believe we need to carve out of to provide services, but also to regulate what needs to be regulated. And I don't have a crystal ball, so I can't tell you what it'll be like, but.
Thank you. We've heard challenges over the course of the last few weeks around food trucks. That seems to be another hot topic right now. And one of the challenges that individuals have said to us is that when inspectors come to inspect their food trucks, they have challenges with language, with understanding what some of our inspectors are saying. How many inspectors does the health department have to be able to speak languages like Spanish?
Sure. So we have, I want to say at least 10 bilingual sanitarians and sanitarian supervisors, and they're not just bilingual in Spanish. We can get you the exact numbers, and because we do track language access, but we would much rather, council member, use the language access service and the appropriate translators, because that way there's nothing lost in tone or affect or anything like that. So our team does use the language access line, and if and when needed, we also use the live interpreter services.
What is the time that food trucks are supposed to close currently? Their permit states what? What does their permit say?
So the mobile vending trucks for food are given a license for a food license. There's not a timestamp on it. We don't necessarily look at the hours of operation. However, we have to be mindful, and we would work with others to make sure that they don't become a nuisance if they're going past the hours of operation in specific neighborhoods.
Okay, my last question. What is the process of an inspection? I know that some food trucks have an electrical draft. They don't move to commissary every day. Do they know when they're applying for these permits? Does the health department give them something that gives them very specific instructions of the process for them to operate?
Sure. So the health department has extensive food safety regulations, and when we carve out mobile vendors, and I believe the last number we have about 1,169 legal, not illegal, legal food vendors, mobile vendors in the city that are approved to operate, and they are licenses. All of the food safety regulations and all of the requirements and operating requirements are available on our website. We also have made videos and other items. Our inspection process is to educate, then regulate. So during the course of the inspection process, we also explain to them how they should be operating, what to look for. Our inspectional focus is really about food safety. So what is the hot water temperature? Are folks washing hands? Do they know the most common transmissible foodborne illness diseases and all of that? We also look for vermin and making sure that equipment is properly being utilized and it properly works. So all of that information is available in writing and easily accessible on the website.
Thank you.
Thank you. Chair recognizes Councilmember Gilmore Richardson, followed by Councilmember Gaudier, then Councilmember Phillips.
Thank you. Thank you very much, Mr. Chair, and thank you all so much for your work and all that we do together throughout the year. I wanted to just quickly get through all of our thank yous, starting with DBHIDS. Of course, Commissioner Williams, we appreciate you so very, very much. LaVann White for always responding to the call. Donna Bailey from CBH, who we've had several calls with, and she's been exceedingly helpful. Malik Gray and Andrea October. They are out of sight. For 5 years, we have worked together to put on a grief program during the holiday season, and the program is always very well received, and we're able to connect a number of constituents to additional services that are available as a result of that program. And so we are just so grateful for their continued partnership. And then for health, of course, Dr. Palak Ravel Nelson, kudos and congratulations to you. Also to Dawn, I'm going to mess up her last name, Kaiswetter, who has helped us, and it was even with us with some of the drug paraphernalia tours previously. Dr. Mehta, who I just happened to see at Penn for Black Maternal Health Week conference, where we both spoke at an event. And Dr. Frank Franklin, who worked with us to present to our nonprofit task force. I just wanted to say thank you to those team members, and that was from my team and I. I wanted to quickly start with health relative to the subject of Black maternal health. Last year, I had secured an additional $1 million for maternal health in the budget to help with a maternal health mini grant program. And I just wanted to get on the record, because we'll have to do this again for this year. We actually just approved the additional funding in the mid-year transfer that was approved by the council this last Thursday. But I wanted to talk about the open grant process for the Black maternal health organizations. How will that process work? Do we have sort of like a timeline on when to anticipate the information to apply for the opportunity will be released? And if you could list for us the organizations that received grants last year, and if there's any carryover or leftover money and how much it is.
Absolutely. So there was $1 million provided for maternal health programming. Of that, $500,000 was awarded to or transferred to our ambulatory health services division, who does the actual work, so that we could efficiently start utilizing the money to take care of our moms. And then the other remaining $500,000 was provided in a series of mini grants to 11 organizations. That process was RFP'd. It was vetted out. Each of the organizations were given the availability of the funds were posted in February, and the opportunities closed in March, so there was ample time. And the organizations, we received 38 applications, and the awards were given to AFHO, Chosen Kin, Family Medicine Education Consortium, Growing Resilient Communities, ITAV Foundation, Mindful Well CDC, New Voices for Reproduction Freedom, PAN, Puentes de Salud, Reclaim Black Motherhood, Women in Transition.
Thank you very much for that. My request for the record is that we receive the information for the dollars that we just appropriated under the mid-year, so that we can also alert the organizations to apply, and that we know when that opportunity opens up. And I heard the bell, I want to honor the clock, but very quickly I just wanted to get on the record that if we could talk through how the Department of Public Health is working with licenses and inspections, and also the nuisance business task force as it relates to the stores that we are all dealing with, these nuisance businesses that sell drug paraphernalia across our communities. And then my last question, so I can get this one in, because I won't come back for the next round, is relative to minority participation numbers, both for DBHIDS and for CBH. And I just received an email, all of the colleagues received this within the hour, regarding the closure of wedge recovery centers. We didn't know anything about this until like just now. So if we could get an update about wedge recovery centers and how we're going to help individuals who are seeking to get into recovery. I mean, we literally just got this email since we've been sitting here.
Absolutely. Regarding the MBEC participation, would you like me to answer that first?
Yes,
Okay.
yes.
Okay, thank you. It looks like, and you mentioned community behavioral health, we have 112 nonprofit provider agencies, and we have 88% of our CBH nonprofit agencies are minority or women operated. We have 23 independent practitioners, and 52% of those practitioners are minority or women operated.
Excellent.
Yeah. And then we have some numbers around our group practices and additional types of for-profit programming. Would you also like those numbers?
Okay.
So in terms of our for-profit providers, 73% of those providers are minority or women-owned. And then in terms of our group practices and our CBH network, 86% of those providers are minority or women-owned.
Excellent.
Thank you.
That's excellent
And then in
numbers.
terms of the email that you got about the wedge, I'm going to ask Donna Bailey to come up and
Yes.
talk a little bit more about
Yep.
that. Thank you.
Thank you. Thank you very much.
If you could be very brief in your response so we can move on to the next members. Thank you.
Thank you, and good afternoon, City Council members. I'm Donna Bailey. I'm the CEO of Community Behavioral Health. So yes, last week the CEO of Wedge notified myself that they had made the difficult decision to close the agency. It was our understanding that they were just going to be telling their staff today, so we had not shared with our organization either. So a little alarmed that there wasn't better coordination with our team.
Well, I apologize for that because one, I just want to get this on the record. I would never do anything like that, but it literally just came to our
we
email. So I
understand.
was like taken aback. I'm like,
Yeah.
we knew nothing about this. So I want to apologize. I'm sure it's out there now. But we just received an email that was not from within like government to say that it's confidential.
Yeah.
So I apologize
No worries,
for that.
council member. I'm sure once they told their staff, you know, these things tend to get away from folks.
Right.
Yeah, but so they did make the unfortunate decision to close the entire agency. So, you know, I think they've been struggling post-pandemic with workforce issues and that nature. So we're going to be working, you know, hand in fist with them to make sure that all of the members across all their services have choice in terms of where they're going to go. Our call last week was very brief, so now that it's more public, we can drill down into exactly how many members are on which levels of care and where we have capacity in the network, but we do believe there is existing capacity.
Okay.
Sorry you all had to hear about it that way.
I apologize. I just, and again, you all know that this is nothing that I would ever do if I knew
Yes,
that.
of
We
course.
literally have been sitting here and we just received this information. It didn't indicate that it was confidential. So I'm thinking that everyone knows about this. There's a plan in place so that there's no alarm, meaning, you know, within the sort of provider network that, you know, we have everything under control. But I appreciate that you all have already been on top of this and that you all are coming up with a game plan to address this issue. And again, I want to apologize to you and to your team because, like I said, we had no idea. And I wish, you know, it would have been better coordination just even with us getting the information in that way.
And we'll make sure that we follow up with the CEO as well, because I'm sure that's not how he intended to go as well, but we know these things sometimes happen.
Thank you
Thank
very
you.
much.
Thank you, colleague. Chair recognizes Councilmember Gaudier, followed by Councilmember Phillips, and then Councilmember Landau.
Thank you, Mr. Chair. Good afternoon to all of you. Thank you for being here and for all of your work every day on behalf of the city. I wanted to second the council president's comments earlier about getting an update on the dashboard that we had worked on with Dr. Abaya, and also, you know, our other partnerships to track our ability to address gun violence as a public health crisis and grow those proven strategies. I remember we also were working to grow hospital-based intervention throughout the city, and I think we had pushed some resources to public health in order to do that work better. And so I don't want us to lose track of that. Now that we're seeing better numbers with gun violence, it still has to be a top issue, particularly on the youth side. My questions are about mobile crisis units. At the March 17th Joint Committee on Mobile Crisis Units, I asked about pay rates for mobile crisis staff, which appear to be considerably lower and less competitive than similar private sector positions. Have we been able to gather any information on this, and is there a plan in place for addressing the issues of low pay staff and staff turnover? And then secondly, it's my understanding that part of Penn's study of mobile crisis resources is a workforce study for the staff who provide services like our crisis line and the CMCRT team members. When do we expect to have the data from this survey, and how do we plan to use this data to improve workplace conditions? Obviously, the mobile crisis units are very important to our ability to compassionately address mental health, and so I just want to make sure that we're doing our best to compensate and create a good work environment for those teams.
Thank you, Councilwoman, for that question, and thank you for all of your support that you've given us around mobile crisis. So yes, we too, have been concerned about the workforce landscape. And in terms of mobile crisis, the monies that we have been given, a part of it from City Council, we've used to create bridge teams. We used to try to create some sense of equity across our mobile crisis teams, making sure that the teams were able to, the providers were able to give some incentives where they could. They were able to increase the pay rate if they could. The issue has been, even once we have increased the pay rate, we haven't always been able to fill every slot. But we have made sure that we've done a workforce analysis to make sure that we could, where we could, make it competitive.
Will we be able to see that analysis and get specific information on those incentives and the level of the pay raises that you provided?
Yes, we can get that to you.
Thank you very much. Thank you, Mr. Chair.
On time. Thank you, colleague. Chair recognizes Councilmember Dr. Phillips, followed by Councilmember Landau, and then Councilmember Young.
Thank you so much. Honestly, I think that these two departments, even though they're similar in nature, should be probably separated because there's so many questions. But first question I just want to have is about staffing with the Department of Public Health. I want to have a better understanding of how many of the staff that you have currently with the department are in-house staff versus staff that are not in-house, in terms of do you utilize consultants and so forth in the department?
I apologize, council member. Are you asking in general, or
Yes,
are you talking
in general.
about specifically for RATs?
So are you, the specific question is, are private employees almost the majority of your staff with the public health department? And does this, what is the configuration of that, and why do we have more, is there more private employees that are part of the staff as opposed to staff that are, generally hired by the city?
Sure. So we definitely have, majority of our staff are civil service staff. We do have contracted staff that work, they're embedded contractors that work within the health department to do work. We pivot and hire embedded contract staff to do specialized work, specifically as it pertains to grant funding. So for instance, during the pandemic, we were able to hire, using grant funding, hire contract embedded staff through the various contracting agencies to go do work that for civil service positions that did not exist.
Okay, thank you. So is there a way to begin to look into examining whether or not the civil service positions can actually, qualify for the contracted staff that you have as opposed to, and that would probably save the city some money as well.
Absolutely. So, sir, one of the areas that we're trying to attempt, and we've been working on this for the past about year and a half, is looking at our epidemiology titles. Currently, the civil service system has one epidemiologist title that is available for the entire health department. So we've been working with the Office of Human Resources as well as our own HR department within health and our different divisions to create civil service job specifications for epidemiologists so that we could have positions that are civil service for whether it's general fund or contract dollars. So that part of the challenge with the health department is that since our titles are so specific, creating a job spec is required before we can fill them. But we are working on that, and you know, we're hoping to have the epidemiologist series completed by the end of this calendar year.
And I just also want to follow up on Councilman O'Rourke's line of questioning, but I'll follow up with you more about,
Yes, sir.
you know, the civil service and so forth. But just real quickly, Councilman O'Rourke was talking about life-saving treatment when it comes to HIV prevention and so forth. As we know, PrEP is something that's been out here for a long time. Is that something that your department can do more of to help raise awareness around the city about the usage of that? I see you at different community events highlighting that, showing that, but how do you wage a campaign in the city so people can become more familiar with PrEP when it comes to HIV prevention? Sure.
So our Division of HIV Health does work with, I believe it's MASCAR media groups to go ahead and one of our campaigns has been Philly Keep On Loving and a few other such activities to go ahead and raise awareness. And I can absolutely get you additional details through the Council President's office about the whole host of activities that our Division of HIV Health does as they pertain to raising awareness, giving education, getting folks connected to services that they so desperately need so that we can prevent HIV.
And just real quick follow-up, and I'm a quick question on this, and I'm going to do the rest of the questions in the second round. The staff budget to keep 988 open 24/7, how many cases are suicidal related for 988 that's 24/7? And is it necessary can some callers be diverted to another source as well as doing suicidal related work as well, you know, when it comes to 988? This is what I'm hearing from different people as well.
So 988 is with DBHIDS.
Yes,
and
sorry
so
about that, DBHIS.
Yes, so the first question you asked was how many of those calls are about suicidality?
Yes, it's about being suicidal, correct.
I don't believe that I have that information with me today, but I can get it back to you.
Okay, thank you. And just one last comment I just want to say. I think both of you, the social medias I've examined for both of your departments could be a lot stronger. It could really help you all with like some videos, some demonstrations that can potentially go more viral to help people understand about the different public health issues that are happening in the city, as well as, you know, even a demo on what a mental health counseling session could look like to make people feel comfortable from DBHS. You know, I'm just looking at your social media. One of your DBHS hasn't, you know, posted sporadically, you know, not even frequently, and same thing with Department of Public Health. And this could be really useful as you're trying to get more young people excited about the things you're talking about. And I really think, you know, working with the communications team in the city of Philadelphia would be very helpful for you all. I just don't see that in this budget, so it makes me a little concerned.
We agree with you completely. That's one of the major focuses that we have now going in place, council member, is looking at public health and rebranding and looking at public health in action to figure out how we can get folks excited about public health and their well-being, and get absolutely social media and all the different, you know, TikTok videos or whatever is the way to get public health messages communicated.
Absolutely. Thank you. Thank you. Thank you, Chairman.
And I just want to speak to that as well. We agree 100% as well around the use of social media. In fact, next week, May 13th, we have a meeting to look at our marketing and our communication strategy specifically around social media to make sure that we are engaging, our various audiences so that they really understand about behavioral health and what it is and common diagnoses. We also have a Healthy Minds Philly website that we're revamping as well that provides a lot of education and resources from on a community level, really easy to understand and sort of one-click resources. So we're right there with you. Thank you. You'll see the evidence of that in the upcoming months.
Thank you. What's your timeline? I hear upcoming months, but what is the timeline, like a hard timeline on some of the things that you just said would be changed based on what Councilmember Phillips
So
says?
the Healthy Minds Philly overall is happening right now. So by the end of summer, we should have that completely up.
So by the summertime,
Yeah.
Councilmember Phillips will see a difference in your presence in
Yes,
social media.
Absolutely.
Thank you. Chair recognizes Councilmember Landau, followed by Councilmember Young, and then I believe Councilmember Bass. You had first round? Yes, so Councilmember Young, Councilmember Landau, Councilmember Young, Councilmember Young, then Councilmember Ahmad, and then you'll be the last person for the first round, Councilmember Bass. Oh, you went on the first round. I apologize. So Councilmember Bass, you'll be last. It's tough to read. Chair recognizes Councilmember Landau.
Thank you. Thank you all so much for being here, for everything you do for Philly. I have, I think, 2 questions for the Health Department and potentially 2 for DBHIDS. The first, for the Health Department, thank you for the work you do with Philadelphia Legal Assistance with your medical legal partnership. I think it's an incredible model that is helping, it's like a holistic work and solutions for a lot of families. In today's funding environment, are you experiencing any financial challenges to maintaining this very successful project with Philadelphia Legal Assistance?
So we're continuing to work and continuing to write our grants and continue to get funding. Right now, I think overall as a country, we're worried about the funding atmosphere, but we just are continuing to do our work one step at a time and seeking additional funding as well as maintaining the funding that we have.
Okay. And I have a funding question. I'm trying to, I'll stick with funding for a second. I'm going to switch over again. The mayor made it clear that she does not want to spend city dollars on syringe exchange, and then also said that she was going to try to see if philanthropy would fill the gap. How far along are we with that?
So thank you for that question. That was one of the items that actually the mayor discussed while I was being interviewed by her and the team. So we're in the process of scheduling, I believe, my chief of staff and I have a meeting scheduled with several of the foundations coming up in 2 weeks. I was trying to finish our budget meetings and then get those scheduled. And so we are, again, we're using all of the tools that we have in our toolbox. So we are working, our division of HIV health and our super division are working on what are the upstream solutions, because if this was not available to us, what would we do? And then as we were charged by the mayor's office, we're meeting with philanthropy to figure out how we can raise the dollars for the other forms of harm reduction.
Okay, let me dab a little bit more into the funding issue, because I'm very interested also if the Medicaid funding dries up, what are we going to do? What payment models, like pay for performance, pay for treatment, value-based purchasing, would, between DBHIDS or the health department work, lead on if Medicaid funding is dried up?
I'm going to let Dr. Williams and Donna,
thank you,
Ms. Bailey answer.
Thank you. I'm going to call up my team member, Donna Bailey, CEO of CBH.
Thank you.
Good afternoon again, members of council. I'm Donna Bailey, the CEO of Community Behavioral Health. So we are the city's behavioral health Medicaid managed care organization, and we're fully funded by Medicaid. In fact, our federal match is 54%. So we are extremely distressed about the potential $880 billion cuts, as well as any policy reforms that would go along with that, that would potentially restrict eligibility or our ability to have the robust network that we have. So what we've been doing, as Dr. Williams alluded to earlier, is contingency planning. And you heard about one agency making the decision that it's no longer going to be able to deliver services. We are concerned that other agencies will make that hard choice as well. We do think that given potential cuts, the state is not going to be able to make up that match. And so we are looking at restricting or constricting our network. We are hoping to do that in a strategic way because we don't want to lose geographic access. We don't want to limit members' choice. But this is what we're planning for.
That's very unfortunate. Thanks for that. If there's anything we can do to help you push back on this or to advocate at the state, we would be so happy to do it.
Thank you.
Thank you. Chair recognizes Councilmember Young, followed by Councilmember Bass.
Thank you, Mr. Chair, and good afternoon. My questions are for DBHIDS. So we all know that there is the rising demographic and overdose deaths in our city is among Black men. And just to give some context, we all go through it. I lost one of my best friends. He was in his 30s to overdose. Lost a cousin. He was in his 30s to overdose. Lost my dad, right, due to complications because of overdose, right? So these are all Black men. And so can you, with that context, and I know that the DBHIDS is trying to increase its capacity for treatment, but could you talk to us about what is your licensing process to provide medically assisted treatment, and particularly talk about in the context of in areas where those Black men live?
Can you archive that question from Councilmember Young real quick? I want to recognize Councilmember O'Rourke for the point of information on a statement that Councilmember Landau made, and your response to that statement, followed by Councilmember O'Rourke's point of information. Will revert back to Councilmember Young's line of questioning. And I'm not going to count this against your time.
Thank you.
Thank you for indulgence, Mr. Chair, and my apologies, Member Young, on this one. A quick point of information on Member Landau's question. Does public health have a response to that question as it relates to those cuts and plans?
The question related to
what Member Landau asked.
Medicaid. So about 40% of our ambulatory health services patients or so are on Medicaid, and we are looking, we serve everybody, whether they're insured or uninsured, and we're working internally, same at CBH, to figure out how we would absorb and still continue to provide the services that we do.
Okay, thank you.
Thank you. Councilmember Young's line of questioning now, if that's okay. Would you like him to repeat it?
I'm going to ask my Deputy Commissioner, Amanda David, to talk about the licensing process.
So you don't need him to repeat the question? We're good to go?
I do not. Thank you.
Thank you, ma'am. Thank you so much.
Hi. So the licensing process actually goes through the Department of Drug and Alcohol Programs, who licenses programs to provide drug and alcohol treatment. So what we can do is we can facilitate that connection between providers and the Department of Drug and Alcohol Programs, but they provide the license ultimately.
So what role does CBH play in that process of determining if a provider is able to provide that medically assisted treatment as a part of their program that they already have?
I'm going to ask, Donna will come up and talk about that.
Thank you for that question. So for any provider to participate in the CBH network, they have to be licensed by the state of Pennsylvania, enrolled in the medical assistance program, first, and then they would be credentialed by CBH. And so the credentialing process would be a review of the facility, the staff files, the policies and procedures, and we would take that recommendation to our credentialing committee. So that's the process for entering the network, whether it's through DDAP licensing or OMSAS licensing.
Thank you. And I asked that because I premised that question based on some facilities that are in my area, my council district. We have an organization that is licensed to provide this work in Atlanta, Georgia, but can't get the license here in Philadelphia to serve a population of black men and women that are the highest rates of overdoses now in the city of Philadelphia. So just trying to figure out how and what, now we just heard about, you know, another facility closing today, right? So that serves that population. So how, I just want to get some more information on how we can get these providers up to a certain standard for you all to allow them to serve our community and serve that population.
Yes, just to restate, it all does start with the state in terms of licensing, but I will say that DBHIDS and CBH have been working together to do some degree of training and education for agencies that might be interested, because we do know Medicaid in particular is complex, and so there are community-based organizations that might have an interest but might not understand how to go about it. So we've done one of those trainings this year and anticipate doing another next year.
Thank you, Mr. Chair. I'll save them next round.
Thank you. Chair recognizes Councilmember Bass, and then after Councilmember Bass, we will start the second round.
Thank you, Mr. Chairman. Good afternoon. How's everybody doing? So I had a couple of questions, and I just actually want to follow up on Councilman Young's line of questioning, because something that came to my mind, and I apologize if this was already mentioned, because I was a little bit late coming in. So, but one of the problems that we have, because we have, you know, like Philadelphia has a substance abuse problem. It's a real problem, it's a big problem, but I think one of the biggest problems that we have with providers coming into neighborhoods is when they sort of go off the rails, when they're not really providing effective treatment, when they're not really servicing, when it's a money grab, when it's sort of like, you know, like almost like a hustle to say you're going to treat people for substance abuse disorder and you don't. And so what happens is, you know, a provider may move into a neighborhood, you know, it goes off the rails, there's no follow-up, enforcement, supports that the community gets, and therefore it's unlikely that we're able to get more services in a neighborhood because people don't want to have to try to fight what's supposed to be a community-based organization providing services to a needy population. And there's sort of like no level of enforcement from the city once that happens.
And so your question is about what does the city do?
Right, so what can we do to provide enforcement? If you get a call from, someone saying, you know, this drug provider or drug treatment provider isn't acting right, people are loitering out front, they're, you know, they're buying drugs from the local drug boys, they're, you know, doing all kinds of things that they really shouldn't be doing because they're supposed to be in treatment, and this is happening, and it's adding to sort of like a influx in a climate in the community that the community finds unacceptable. And then, so what are we doing to make sure that we address what's happening with that particular provider? Because we need drug treatment in our communities. You know, we all have family members, relatives, whatever, who have gone through treatment, are in treatment, need it, but we can't get providers because we don't enforce the rules of sort of engagement in the community.
I understand. And Councilwoman, you know, we've worked together on this very issue, so thank you for bringing up to us again here. We have a robust compliance and quality program. You know, when we have received calls, you know, from your office, we worked together, we came out to make sure that the community was aware.
Well, let me pause you, because I hear what you're saying. but I think almost, in most of my district, there's a few exceptions, there are a few outliers, but I think at most of my district, if you ask folks, you know, is this treatment facility doing right by the community? They're going to say no. And when they come before an RCO, or we try to get zoning, or we try to get, you know, more of what we need in the community, we can't, because people have had this experience and they don't want more of it.
So let me bring up Donna Belly so we can talk about what that process looks like when we do get those calls in about a provider.
You know what, I know I'm short on time, so I just want to jump to it, but what I would really like to hear is what are we going to do going forward? Because what we're doing, I'm going to be honest, I don't think it really works. If you have a good provider, and I do have some really good providers. I had one provider that was so good that people didn't even know it was in a neighborhood. They didn't even know, oh, that's a treatment facility? I had no idea. They had been there for 25 years. But for the most part, people know, are aggravated, don't want to support it, even though they may have people from their families who need treatment, just like all of us. But they don't want more of the same in that neighborhood because we can't get enforcement from the powers to be when something goes awry.
Thank you for that, council member. So I would say, just as Dr. Williams said, we do have a very robust quality oversight process. We do take complaints from members, but also community members. And as a part of our procurement process, we really do encourage prospective agencies to be good neighbors, not only in terms of gaining community input at the onset, but certainly in an ongoing way. And so if you have names of agencies,
I sure do.
we will happily follow up.
And it's nice to say we expect them to be good neighbors. That's nice. I expect my neighbors to be good neighbors. You know, everybody expects their neighbors to be good neighbors. The reality of it, though, is something really different. I can point you to a few sites right now where I know that there's like 20 people standing around, you know, outside of a treatment facility that, you know, is causing other businesses, it's a disruption to other businesses, and it's making them leave the neighborhood, and I'm very sad about that. And I really want people to be able to get treatment, but I also don't want to lose, you know, other elements of the neighborhood that have been successful, you know, minority businesses that are moving out. But I'd be happy to talk to you off the record because I don't want to call anybody out.
Absolutely. If they're a CBH provider, I would like to know about them.
Absolutely, they are. So, all right, thank you. I'll come back around on the next round.
Thank you. We will be starting the next round now. I believe everybody who wanted to go for a first round has went. So we'll start with the chair, Councilmember Ahmad, and anybody else who wants to have questions in the second round, please queue yourself up now. We're going to try to stick to the time limit on this round just because we want to be as efficient as possible with the normal hard stop time that we have. So we're going to really try to stick to the time limit, so if folks can ask their questions, that'll be great. Chair recognizes Councilmember Ahmad, followed by Councilmember Lozada, then Councilmember Gaudier.
Thank you, Chair. This question is for Dr. Marquita Williams and her team. It was really phenomenal that you have been able to engage over 9,200 unique individuals living on the street across the city and made 38,594 contacts that resulted in 23.5% accepting housing or behavioral health treatment placements. My question is twofold. One, what are these folks tracked once they're in treatment or housing to see are they able to stay and retain those spaces or keep their treatment and come out successful? What is that process? And the second thing is, for those who you were not able to move to either treatment or housing, which is the remaining people, what happens to them? Are they being tracked, and is there a continuous approach, repeated approach with them to ensure that they are able to be successful as well? And last question is, do you divide up this whole, this is the chronically homeless, or this is newly homeless, or these are people who are in between couch serving? How do you divide up this population that you're serving in terms of who they are and what their needs are, because they all need different levels of care and engagement based on the root reason for them being homeless?
Thank you, Councilwoman, for that question. Going backwards, yes, individuals who we have attempted to engage who do not take the services at that time are continuously engaged, over the time, because the goal is that whenever individuals are ready, there's barrier-free access for them to come into our service system. So we continue to engage those individuals. In terms of how the groups are broken down, I'm going to let Deputy Commissioner David talk a little bit about that.
And if you could be very brief in your response, because time is up. We want to move on to the next members.
Hi, thank you for your question. And so yes, we do track individuals when they come into our system through each part of our system, and we have continuous engagement with those folks. So if a person is on the street and moves into housing, we have continuous conversation with that individual and try to move them on to the next levels of care as they're accepting of the recovery process. The other thing that we do is if a person disengages in treatment, we do follow up and we go look for folks, and we continue to have those engagements with individuals as they're accepting of services.
And very quickly, attrition rate for those who accepted help.
So recovery is a nonlinear process, and I don't have the exact attrition rates at this point, but we can take a look at it and get it over to you guys, and share that information.
But not everybody who you take in are people with substance disorders. Some could have chronic mental health disorders.
Yes.
So they're different. There are different populations within who you place. That's what was my question. How do you separate out the different types of people, because they'll have different responses and different requirements? Just wanted to see how disaggregated we are in our approach to have successful outcomes for placements and future placements.
Yes, so we have placements for individuals who have substance use disorder, we have placements for individuals who are primary mental health, and then we have some co-occurring placements also called dual diagnosis. And so with that, the approach is very similar with engaging individuals on the street. It's engagement, 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 and then really the outreach workers begin to formulate a plan around each individual, and then they start to target conversations around which programs might be best for that person, begin to have conversations related to, potential opportunities for that folks.
So 23% is a very low rate. So I just wondered, what do we need to do differently? We've been doing this approach for a long time.
Yeah.
And many of these folks, if you leave it up to their decision-making, which is particularly those with substance disorder, is already not operating in full potential. How are we working with them to let them decide how we move on this? My question is, how do we increase that 23 point whatever number it is? Because that's not good enough. That is just not good enough. And we need to figure out how we do better in that space, and where are all these accountability measures for those impacted and those who are giving the services both. And I think there's a level of that we must expect from everybody in Philadelphia, regardless of what their status is. Because you can't on the same hand say they are too compromised to make a decision, we can't force them, but then they are not compromised enough, they're making a decision in their full right, so we have to honor that. So there's a rub there between either being impacted so greatly by substance disorder that you're not able to make rational choices that are good for you. So I want to know how this industry is dealing with that. I have not seen that anywhere, because this is such a touchy subject. We don't want to go there, and then we'll keep having 23% as our success rate. We can't be satisfied with that. We have to think outside the box, and we have to think how we move the needle on this. And you are the folks who have to be tasked with that.
Yeah, I think it would really be
After
great-
this, we're gonna have to move on, so let's
Sorry.
make sure we get a good answer.
Thank you. I appreciate that question, and I would love to partner with your office to begin talking through what kind of opportunities there are to increase the numbers in that way, and to begin. I hear where you're going with that, and so I would like to have more discussion
Yeah.
so that we can partner.
Thank you, Chair, for indulging me.
Thank you, Chairwoman. Thank you for your leadership on this particular issue and with the committee in general. Chair recognizes Councilmember Lozada, followed by Councilmember Gaudier.
Thank you, Council President. I just wanted to follow up on the Councilmember Bass's questioning around oversight for providers. We had a special committee hearing on Kensington where we talked about the very same issue. And we agreed that we were going to look at our process and we were going to figure out what and how we could do better. What did we need to change that was in our current process that would allow us to better understand the work that folks that were receiving contracts from us were receiving and how they were actually delivering. And so I'm curious to hear, I heard you say that we do have a process for oversight. I'm curious to hear what did you find in the oversight? What were some of the challenges and what were the corrective action plans that some of these providers put in place in order to respond to being a nuisance in their communities? In addition to that, I also want to know, could we as district council people receive a list of who are these providers in our community, right? As the council member mentioned, there are some providers that are great providers that we don't even know they exist because they conduct business in a very effective, responsible, respectful way to the community. And then there are others that are outright crazy and disrespectful, and they will start a fight with the community members. And so could we get that? Is that a possibility?
Yes, absolutely, you can get that information. And in terms of looking at the providers if we got a report, like I know Councilwoman Bass said that there are some providers that she would want us to look into, we can look up those providers and have a conversation with you generally about what the process is when we get information that providers are not providing the services that they're contracted for, and what that looks like, what the corrective action plan would be, and what the timeline on that would be. So
But did you guys do that already? That's what I'm asking, because we talked about this about a year ago, right? So I want to know, did you all do what we committed, or what you committed you would do, which was do an assessment of who the providers are and whether they were good, responsible providers or not? And if you did that, what were some of the challenges? Because we also talked about the fact that there's billions going into districts like mine, right? In contracts. And my community told you in that special committee on Kensington that there were many providers who were not good providers. We talked about redirecting dollars, right? Because what good is it to give a contract to a provider who's continuing to deny the services that our community needs so desperately, right? So have we done that? What happened? You guys have had a year. So I'm just curious about what your findings were.
And so we haven't done the comprehensive exercise that you're talking about, but in terms of looking at our providers and key performance indicators and benchmarks clinically that we're looking at, we do that routinely. If there is a provider where we get some information that's outside of that, so to what you're talking about, meaning they're not providing a certain service or there's some bad actor behavior happening, that takes on a different course. And so where we do get those types of referrals or that type of information, it would be a separate inquiry and it would be a separate action. So in terms of looking at our entire network and trying to pull out who the bad actors are, that would be a more complicated process because we would need information from individuals who have had those experiences that we would need to investigate. But there's a routine process for making sure that providers hit certain benchmarks.
Yeah, I think that's it.
I know we kind of tight on time, but go ahead, take another minute, Councilmember Lozada, because I don't know if that answer was adequate to what you're trying to accomplish right now.
I mean, I think I got it. I got the answer, right? No, what we committed to doing, we didn't do. But I think that we should do it, right? I think that you, as a department, you need to look at who are your providers? And what did they say they were going to deliver to a community? Did they actually do that or not, right? And not just because they're checking off boxes, but because somebody went out into the neighborhood to say, you know, how do you assess this provider? They're in your community. They're providing services to the people around you, right? How do you rate them as a provider? And then how do we compare to contract deliverables, right? That's what we committed to doing, because we know that in districts like mine, people are making money off of the need that there is currently there, right? I've said this before. There are friends of friends who have contracts who are doing nothing, you know? And so we need to, if we are going to change what is happening in the neighborhood, we have to recognize that. We have to recognize that Kensington has become a money mill, and that's the truth. And at some point, we have to stop that.
If you want to give a brief response, you give a brief response, and then we have to move on to Councilmember Gaudier.
Thank you, and thank you, Councilwoman, again. And so in addition to what I was describing earlier around sort of the standard types of protocols and looking at providers, we do have customer satisfaction teams that go out and interview members and interview community members and interview staff to get at some of those very types of challenges that you're talking about. Then we have a network accountability group that goes out and looks at another set of benchmarks and performance indicators. So there are varying levels of compliance and oversight that happens in the department, and I think it would be helpful for us hereafter to talk to you about what that looks like and what the various levels are, so that if there are places where, you know, there's some things that you say you've been seeing or you've been hearing that we haven't been aware of, we can create the kind of mechanism to then address that as well.
Thank you. Point of information, Councilmember Bass, and then we have to move on.
Thank you. Please don't take me off of cue. Thank you. So, can we get a list of, you said that there's a team that goes out and does these surveys. Can we get a list by district of what providers were touched, or, you know, this survey, or, you know, contact was made? And when? Can we just get a list, because I've never heard of it?
Yes.
I'm surprised to know that it exists. And I'm just curious when, if they've ever been in the 8th Council District, and what was the conversation and what was the result?
Yes,
Yeah.
we can get that information to you.
Thank you.
Yep.
Thank you. And you are in queue. We got you. Chair recognizes Councilmember Gaudier, followed by Dr. Phillips.
Thank you, Mr. Chair. I have a question about our city's contract with ReWorld. For the past several years, our city has incinerated our trash at the largest trash incinerator in the country, located in the city of Chester. And it's not a secret that many Chester residents want this practice to end. They want the incinerator gone, both because of the perceived negative impacts of the incinerator, but also because of the cumulative impacts of the incinerator when considered with all of the other dirty uses that they're forced to contend with. So since the incinerator also neighbors Southwest Philadelphia, I was wondering whether our air management services team has measured the impact of the incinerator on air quality and on the health of Philly residents living within the vicinity. If not, can you talk about how you typically evaluate the air quality impact of plants that might be polluting the air, and whether we're able to use that same methodology to evaluate the impact of the Chester incinerator? And if yes, and you do see a negative impact, are you able to incorporate those findings into the procurement process for our trash management services? And are you working with the procurement department and streets to evaluate other alternatives?
So Absolutely. Well, I can take you through kind of the permit process and be mindful. You know, the air quality is something that it doesn't matter where, you know, eventually if it's down, if Philadelphia's downwind of it, Southwest Philadelphia will get it. Our air management services, we have 10 hardwired meters located around the city, and then we have about 51 PQAS meters, which we can then move around, and we measure the air quality. The hardwired meters keep tabs of poor air quality days. That's how when the wildfires were happening, we were very quickly able to pivot and tell people and give them guidance about, you know, wearing masks or staying indoors or keeping their windows closed or turning off their ventilation. So it's a similar process. The incinerator, because it is located outside of the city of Philadelphia, we're not necessarily the permitting entity, but that does not stop us from collaboratively working with the Pennsylvania Department of Environmental Protection, the Streets Department. It is, you know, potentially our trash that's going there as well. So we are working collaboratively, and I believe it was your office council member that brought this up, and we were at a meeting that was convened, and so we're absolutely working on that. In the meantime, we continue to monitor the air quality. Our AMR 6 regulation, our Air Management Services Regulation number 6, which provides permitting for the Title V emitters, which are the larger facilities, so like the PES refinery that used to be there and all. There's about 27 of those in the city of Philadelphia, and they have to go through a rigorous process now because of that regulation to assess background air quality levels and also take measurements of chronically environmental justice communities, Southwest Philadelphia included. So that is all in the process. One of the first things that we did initiate doing was our preventative education and outreach for the scrapyards or junkyards in the city to keep them, when they do go on, you know, on fire, it causes all sorts of air quality issues. So we've been doing a lot of preventative education, and we will be working in whatever capacity we're asked to on the incinerator aspect.
As we continue to collect this data, you know, I represent Southwest along with Council President Johnson, and I feel a great responsibility to remedy a lot of the dirty uses in that area, but I also feel a responsibility to make sure that we're not negatively impacting Chester. And so I would appreciate any data that we could put into this procurement process to make sure that we're making the best decisions for our residents, but also for the region.
Agreed. And I just wanted, for your injury prevention dashboard question, one of our amazing team members, the chronic disease injury prevention director, the dashboard is up, council member, and it's been up, and it does capture, it tracks shooting, non-fatal and fatal shootings, and there's also maps associated that are available on the dashboard. So we can gladly get you the link for that.
That's great. Thank you so much. And if there could be also a follow-up on the hospital-based intervention work that we were doing together, I would appreciate it.
Absolutely. We'll follow up.
Thank you, Councilwoman. Chair recognizes Dr. Phillips, followed by Councilmember Young.
Thank you so much, Chairman. Given the concentration, this is for Commissioner Nelson. Given the concentration of tobacco retailers in certain neighborhoods, how is the Department of Public Health assessing, particularly youth, assessing the impact on youth and vulnerable populations when it comes to taking in loosies as well as any other illegal drugs at business locations? Is there a zero tolerance for that behavior? What is the protocols in your department? This is also brought up by Councilwoman Cindy Bass at a recent hearing too.
Sure. So it's illegal to sell loosies. So loosies, for those folks that don't know, cigarettes are supposed to be sold in their packaging. Proprietors, however, will sell individual cigarettes, one, to make money, and the tobacco industry promotes that kind of behavior because teenagers or younger folks that may not be able to buy a pack of cigarettes can buy individual cigarettes. So they are illegal. When our teams that go to do the inspections of these establishments. When we receive a complaint and we go do an assessment, we will issue them code violation notices, as well as engaging in cease operation of those establishments if they have a tobacco permit. Our Chronic Disease and Injury Prevention Division also works through the Health Promotion Council, where we hire youth with an adult that go and try to purchase not only tobacco products as minors, but also other such products. And then once those surveys are completed, we go ahead and do enforcement follow-up.
We just heard from about a couple of businesses in the city of Philadelphia where I think some people in your department just issued a violation as opposed to a cease operation. Is it clear that in the cases of selling drugs, selling things without a tobacco license illegally, you're supposed to get a cease operation as opposed to a violation, is that correct?
Sure, so I want to clarify, we wouldn't be involved with any sort of drugs or drug paraphernalia, but if it is a tobacco product that we see is being sold while we're there on site, we would, and they don't have a tobacco permit or a state tobacco license, then we would go ahead and both issue a ticket as well as potentially cease operating the tobacco aspect of it. So for instance, council member, if it is a gas station, we would not cease the selling and buying of gasoline, but we would cease operate the sections of the store that are involved specifically with the tobacco business, and the establishment would need to move those products out.
And that's my concern, and I'll stop here. That's my concern, because I think the whole operation should be shut down as a result, not just one part, because as we examine, they can come back and quickly try to hide it, once they're still operating. And I think that's the policy that we are asking for to change. And I'll let Councilman Best talk about that more later potentially, but
Before you, Dr. Phillips, let me just let Councilmember Bass get a point of information real quick.
Thank you, Dr. Phillips. But I just wanted to say, I heard your comments that if you had to be on site and see, they're not going to sell it to you. Come on, they're not going to sell.
They won't sell it to me, council member, because now,
Right.
but
They're not going to sell it to me either,
Well, they know both of us now.
Yeah.
We've made our rounds, council
We've made
member.
our
They know
rounds.
us. But what the Health Promotion Council does is they have actual youth that they hire. So an adult would be around the outside of the establishment, and the youth would go in that they're not aware of to buy the tobacco products. And based on that is how we engage in the cease operations and/or code violation notices. So that's how it's set up.
So how was it that 5950 Ogontz Avenue was still open when they opened with no license to operate, no use and occupancy, no license to operate, no certificate of occupancy, construction without permits, illegal signage, sale of tobacco without a license, sale of loose cigarettes, tobacco sales on the same block as a school, on and on and on. 12 violations that we have listed, and they're still open. And I just can't, and I know not all of that is you, some of that is L&I, but if we know that, and they're selling fake cigarettes. So these are cigarettes that look like Newports in a pack, but are fake, made in China. So you don't know what you're ingesting. So if we know that they're selling these, what could be very dangerous products, I just haven't seen us do anything yet.
Sure,
Thank you.
No worries. So one of the things that I want to keep in mind is that, and thank you for acknowledging that some of the items are partners within L&I, and we work with them, they handle that. But as far as the fake cigarettes, which you sent us pictures of and we followed up with, what we go and we do refer to the Pennsylvania Department of Revenue, who has a whole entire tobacco enforcement arm, that they go out and they'll confiscate the fake cigarettes and everything. As far as our process is concerned, we would cease operate the establishment. They have upwards of 48 hours to fix the violations. When they fix the violations, then we have to allow them to open back up because they've taken the corrective action.
They don't have a license to operate.
So if it's a I apologize, I am speaking about an establishment that is with a license, open and operating, but if they don't have a license to operate, then we go ahead and work with L&I licenses and inspections to, figure out the next steps for either a 30-day administrative, administrative opportunity to correct it, or L&I will conduct the cease operation.
Member Phillips, we have a hard stop at 4 p.m.
Yeah, so I just, real quickly, I want to be on the record just to say, I don't think they should get an opportunity again, knowingly doing this. We can fight it in court and so forth, but from our city's policy, we should not, have the opportunity, and that's all. They shouldn't get it again. Thank you.
Thank you. Sure, Member Bass. The chair recognizes Councilmember Jeffrey J. Young, then Councilmember Nicholas O'Rourke, then Councilmember Ketty Lozada, and Councilmember Bass. We're wrapping up.
Thank you, Mr. President. Again, questions for DBHIDS. Philly Home at Girard, just like most of my colleagues mentioned today, some of them mentioned that no one knew in that area, in that neighborhood, that place was a shelter until there were this influx of folks with substance abuse issues at that site. So could you tell us how many beds DBHIDS is contracting out at that site, and what is your capacity there?
Hi, yes. So we have 180 beds on two floors, 90 and 90, and they're full today. If that was your question?
And yes, thank you. And what's the intake process for someone? I mean, that was full, right? But if someone leaves, what's the intake process to allow a new individual to, receive services there?
Yep. So individuals are engaged by homeless outreach, and then if the individual is appropriate for and willing to go to the Philly Home at Girard, the outreach teams will call our offices to ensure that there's a bed. If there's a bed available, the outreach team takes the individual to the Philly Home at Girard and makes a warm handoff to the staff that are there. Once the individual arrives to the location, the outreach worker will stay there as the individual receives an intake assessment. At that time, they're given food, because a lot of times folks are hungry. They are offered light physical health care, like first aid. They do a minor assessment to see what the individual's needs are, and then they're transitioned up to the residential floor, where they learn about the rules and the regulations of the program, and then are continuously offered services related to physical health, behavioral health, including substance use disorder
Thank
services.
you. One more question. My time is up. But so can you tell us about you say they have to go through a certain, make sure they fit the standards in order to qualify to reside there. Can you tell us, do you have to be addicted to substances? You have to have substance abuse addiction in order to receive a bed at Philly Home at Girard? At
the two
floors that
the 2 floors that we have, yes, it is targeted to people who are using substances or and focused toward recovery.
Thank you. And just for the record, Mr. President, I just want to put on the record that we had OHS here last week. They have 132 beds there, and then now we learned that DBHIDS has 180 beds there, but their beds are only for folks that have history of substance abuse. So just wanted to get that on the record. Thank you so much.
Yes, thank you.
Thank you, Member Young. Councilmember Nick O'Rourke.
Thank you, Mr. President. I believe Member Gaudier kicked off some of the concerns, at least that I had, around the mobile crisis response teams. As the data you discussed shows, the crisis mobile response team saves lives. I'd like to start by getting a few questions on the record. How does the data for outcomes of dispatches compare now to this time last year? How many calls have ended up in a voluntary hospitalization so far in 2025 compared to last year? And how many calls ended in a 302 in 2024? I'll say them again. How does the data for outcomes of dispatches compare now to this time last year? How many calls have ended in a voluntary hospitalization so far in 2025 compared to last year? And how many calls ended up in a 302 in 2024?
Thank you, Councilman. In 2024, and so we have some data from 23 and 24. We can get you data for 25, but I can tell you in 2023, the number of 302 petitions, was 8,924.
You said in 2023?
2023.
Okay,
yes.
say it again.
8,934. Comparably, in 24, the number was 8,808. Now, those are petitions that were made, but in terms of how many, we have the data here on how many were approved and how many were reviewed. And so I can get you the comprehensive data about 23, 24, and 25 to you probably in a couple of days.
Could you submit that to the chair?
Yes, yes, to the chair,
dispersal? That we
absolutely.
appreciate it. At the committee hearing in March, Local 2186 informed us that the response teams has only one health program manager. For a 24/7 team, I don't think that's enough. And I can imagine it contributes to the burnout and turnover that I know that y'all are focused on combating. Can we discuss why, and I know we don't have much time, but can you discuss why this hasn't been addressed as a part of the proposed budget?
So at this time, I believe that they have another one, so they have two.
They got one now.
They got another one, yes.
Okay, well, praise the Lord.
Progress.
Okay, all right. That, you got a point of information, Brother Phillips?
Point of information, member Dr. Anthony Phillips.
Thank you. I just wanted to bring it up because also I've been hearing about, in terms of staffing, does this budget allocation reflect, especially with low wages and so forth compared to other sectors, how are you recruiting and retaining staff? Is this budget allocation showing an increase in salary for these workers? I just thinking about how are you going to do a better job with retaining staff and attracting them for positions like this, as well as other clinical areas?
Yeah, so we work closely with our providers. We know that this is a position that, leads to high burnout. So we work with our providers around salary increases, around incentives. I believe Councilwoman Lozada asked us to submit to the president what those incentives are and what it looks like, so we can include that in the information that we submit to you. But it really is a result of relationship that we build with our providers and them working on their staffing needs. We can provide the funding to support it, but they're understanding their staffing patterns and sort of what the incentives are that would retain workers relies on the side of the provider. And I do have a piece of information for you from your last round that you
So
asked.
there's just a point of clarity, there's no increase in salary in this fiscal year for staff members who are doing this work?
In this fiscal year?
Yeah.
No, we haven't asked for an increase in salary.
All right. Thank you, Council President.
Thank you.
I did want to let you know, you asked about the suicidality. 70% of those calls had to do with suicidality. You were asking about the calls that came into the PCL line.
Thank you.
So it was Member Rourke had the floor, and Phillips asked for a point of information, and you were wrapping up, correct? Okay, you finished?
One more if you give me some time, but if not,
Go
I
ahead,
can hold
sir.
it. Thank you. This was kind of picked up already by Member Harity a little bit, but I do want to go there myself. Dr. Williams.
Can you speak more into the microphone?
My apologies. I thought I was doing a pretty good job on it. Your testimony mentioned that your continuity of care team provides case management for up to 90 days in connection with the neighborhood wellness court. Only 120 of the 3,400 folks that the team engaged with actually ended in a linkage to case management. That's 3.5%. And I had a few questions that I'd like to get on the record as I get off the mic. What factors contribute to this extremely low uptake? How many of those 120 actually stayed with the case manager beyond the initial linkage? And has anyone successfully completed the 90 days of provided case management thus far?
So the Moore's continuity of care team serves individuals in the wellness court, but also serves individuals that the Moore's team connects with outside of the wellness court. So with the, and the idea behind the continuity of care case management team is really to make those connections and then transition individuals off to other services. So if the Moore's team gets somebody assessed and gets them into some kind of treatment placement or housing placement, they then follow up with the individual just to make sure that the continuity of care continues. And so they've been pretty successful in that arena. The wellness court piece, we are working with individuals, and as Adam Gear mentioned in his testimony, that the data is just not ready to be shared yet. So we would be happy to share it along with OPS data related to wellness court. But the continuity of care team that works outside of the wellness court has had success.
Thank you, Mr. President. Thank you.
Thank you. Member Lozada, then Member Bass.
Thank you, Council President. I just want to get 3 questions on the record that are all unrelated, but because this is round 3, I want to make sure that I get them in. In your 2024, in 2024, you mentioned the launch of Trauma to Triumph. The program serves 100 youth and young adults annually that live in high poverty, high crime zip codes across the city of Philadelphia. Considering this information, how many of the youth or young adults participated and completed the Trauma to Triumph program in the 7th Council District? Through these programs, were the kids ever asked what they wanted? And if so, what was their response? And then how can City Council best support programs like this that impact young people directly?
Thank you, Councilwoman, for that question. So the Trauma to Triumph program, the 100 youth, 75 completed the cohort. We partnered with grassroots community organizations, Every Murder is Real, NAMI, Mothers in Charge, Black Men Heal, and the Philly Children's Movement, based on the interviews that we had with the youth about what they'd like to see, as well as feelings that they had about not being seen or heard in traditional spaces, and we're able to take them through 12-week curricula that, in fact, just like in the last month, they've completed. And so in terms of City Council support, like any resource would be helpful for us to be able to continue to engage additional youth in these programs beyond this initial 75 cohort.
How can we, as a legislative body, continue to support programs like that that directly impact young people?
Funding.
Always about money. And then my other 2 questions is how many needles were collected, or how many needles were distributed versus the number of needles that were collected? Do we have that number?
I'm sorry, can you repeat that question? I didn't hear what you said.
I think it's for the health department. How many needles were distributed versus the number of needles that were collected?
So we can absolutely get you the numbers in terms of what was collected. Our super division does that aspect of the collection. The distribution is not a number that we would readily have.
Okay.
Because that's done through the other entities.
If we can get that, that would be great. And my last question for the record is, some folks spoke about beds and availability. I know that we talked about getting those numbers onto Philly Stat 360 in real time. Have we been able to do that? And if not, when do we think that we will be able to see that in real time?
In real time. So we are working on an RFP for a bed registry. And so that it's taken a while to get the RFP together because we want to make sure that the RFP is comprehensive and includes all the needs. We've also met with all of the bed-based treatment providers in order to understand what would be helpful for them, what would be helpful for the crisis response centers, and what would be helpful for us in general. And so the RFP is due to be released in early summer, and then it'll take time to get things up and running and connected in the network, because what we want is, we don't want it to be an extra job for somebody to do. We want it to be a seamless thing, because things that are seamless will continue, and if it becomes an extra job, we don't want it to become a laborious process for folks. So we're hoping to have that up and running. I can't give you a date now, but as the RFP process rolls out, we can give you more of an update related to what the rollout looks like, if that's okay.
Thank you.
Thank you.
Thank you, Mr. President.
Thank you. I have a brief question for Dr. Williams. And I talked to you about this briefly regarding an initiative that I want to bring to the city of Philadelphia, but just give me an overview on the level of support we are providing for the children in our school district and our charter schools around trauma support. We know gun violence is significant in the city of Philadelphia, and although we're at a historic low, when it comes to shootings and homicides, we've seen an increase amongst juveniles, right? And so I'm one to believe that a lot of our young people are walking around shell-shocked, right, as relates to them seeing their friends being murdered, family members being murdered, and they go to school with this trauma every single day with not really having the ability to process it on its own. And so what are we doing as a city to support such young people? I know we did have one company that had a contract with the city that we don't have anymore. And so if we don't have that contract with said company, what are we doing to be supportive of our youth around a particular issue of trauma support when it comes to gun violence?
So trauma has been one of the pillars of our, addressing trauma has been one of the pillars of our department, for years. And so because of that, we address trauma from a variety of different angles. And so you're familiar with some of the grants that we've been able to implement, like the Recast grant going into the communities, specifically looking at youth and supporting youth in terms of their exposure to violence and the aftermath of violence, meaning the sort of the traumatic sequelae, if you will. We also, through our Engaging Males of Color, work with younger men through the JJC program to, sort of deter them against indoctrination to gun violence and so forth. We just talked about our Trauma to Triumph program that targets a younger set of youth around looking at high poverty areas, high crime areas, high violence areas, and exposure in terms of trying to move people away from the earlier and earlier indoctrination to selecting gun violence as an option. We also work with our providers. There are several providers who are of color who have made a specific culturally competent series of programming to engage young African American and Latino males around understanding violence, understanding the cycle of violence. And so across our system, there are a number of programming. You mentioned also about our school-based connections. So in every school, there's an IBHS provider, that's a behavioral health provider, that would also work with children who are exhibiting some symptoms of trauma. So in various places, whether it's prevention, whether it's actual treatment, whether it's support services, trauma is embedded across the programming, and addressing trauma is embedded across the programming from the department.
Tell me about Network of Neighbors. Are we expanding that particular program that actually goes out after the shooting and the homicide and trains the community on what the community wants to see as a trauma response?
Yes, Network of Neighbors is in high demand constantly. They are out in the community, requested frequently from some of our city departments.
How many staff do we have? Let's see if the administration's, to be quite frank, we talk about a priority. I know when they came at one time, we said, could we expand the number of individual staff, because it was like 2 people at the time for the city of Philadelphia as a whole.
Right.
How many staff do we have now?
So since then, I don't have my number exactly with here, but it's more than 2 people. We've expanded 10. I was going to say.
Let's go on the record and tell me how many, please.
We have 10.
We have 10.
We have
okay.
10. Yes.
All right,
we
so
have
that
10.
investment
Yes,
shows that
we
it's a
have
priority.
invested. It is a priority.
You
and
sure you don't want to be permanent in the position? No? I know y'all watching.
I'm trying to tell you about Network of Neighbors.
She made y'all go from 2 to 10 in
We
a
have
2-year
10.
period.
Yes, and we are, the funding for Network of Neighbors is coming to, a close soon. So we're trying to make sure that we get some additional funding to keep that program moving, but they are in high demand. It's a very well-respected program. We have been able to expand from the 2 to 10. We'd like to expand even further.
Okay.
So.
Well, I know you have members here, including the former Deputy Commissioner of the Office of Black Male Engagement, Dr. Ahmad, and also Councilman Jamie Gaultier, who is advocating around youth gun violence, as well as Councilman Jeffrey J. Young, and members as a whole who have been working on this issue support such expanding of that particular department, as well as Dr. Phillips. And so, are you your hand raised for a point of information, sir?
Yes, quick.
Okay, your point of information, sir.
I just want to say, just going back on my comment earlier, this would be an opportunity for you to, on social media, to kind of display, showing young people the benefits of that type of counseling, because we always say after those events, we always say it's available, but they can't visualize what that looks like. So maybe y'all can do some role plays or skits, something to make it interesting. Thank you.
All right, thank you very much. Wrapping us up.
I'm sorry, if I could just
Go ahead.
answer.
Sure.
So, Councilmember,
Dr.
we
Nelson.
collected 11,921 syringes for FY25, quarter 3. 11,921, the number's dropping this quarter, but that's how many we collected during January, February, March. Okay?
Can you clarify that? That was in response to, go ahead.
Yep, and Council President, I did provide the information about the gun violence, non-fatal and fatal injury prevention dashboard, so we can get you the exact web address and everything for that.
I have it.
Okay,
My
great.
friend Joshua Harris sent it over to me. I have that part. I just want to make sure that the agenda is still on the top priority of the Department of
Yes, sir.
Public Health in terms of moving forward. But yes, I do have the injury prevention website, dashboard, actually, in my phone. But I want to know the response regarding the syringes. I wasn't here for the initial question.
The council member just wanted to know how many syringes we had collected. We don't have control.
Like collected off the street?
Correct, sir.
On the ground?
Yes, sir.
A health department's distribution, right?
Correct.
That doesn't include all of the other uncoordinated providers that just distribute syringes, right?
This is not distribution, this is just collection.
I mean collection,
Yeah.
I'm sorry.
I just want to be clear, it's just a collection. It's a number that we keep track of.
Well, thank you for your work on that, because I know we had a young lady talk about how she has to get tested every so many years for HIV because she stepped on the needle in Kensington, and she gave her testimony in front of members of council. So very, very important job. Wrapping us up today will be the gentle lady from the 8th Councilmatic District from the northwest part of Philadelphia, Councilmember Cindy Bass.
Thank you, Mr. President. So just a couple of questions, and I know we're running out of time, so I just want to be quick about these. I want to shift gears a little bit to restaurants and business closures, because I've had instances where restaurants were shut down for various things. And it's a little confusing to me, because I've had restaurants that shut down that seem to be clean and well organized, and an inspector will come in and there's like, a cracked floor tile, or, they come in July during a lunch rush and the temperature is off a couple of degrees in the freezer and they get shut down. And then I'll have sort of like my stop and goes that never get shut down. And they've got dirty cobwebs hanging from the ceiling, and, and we talked about this before, because it's like, the floor is filthy. They have a restaurant license, and, I was told by one of the inspectors that cleanliness is not something that really rates with the health department when it comes to closures. So can you explain that?
Sure. I'm Not sure who would have said that, but that's beside the point. Our food safety inspection program is based on, it's a risk-based inspection approach, which means that we're not just looking at walls, floors, and ceilings. We're actually focused on actual handling practices, looking at temperatures, making sure that folks that have hepatitis A are not making your salads, so you end up getting hepatitis A. So the inspection form itself has about 54 categories. The top 27 are the risk-based inspections, which looks at everything from whether or not the place has a food safety certified individual, whether they have an understanding of food safety principles about foodborne diseases, whether there's reporting. We look at vermin, we look at...
So let me, don't mean to cut you off, but, so what you're saying, rings a bell. So I think I probably, in my mind, just sort of paraphrased what was told from the inspector. But you're right. What they said was that it wasn't one of the priorities to close a restaurant. But my thing is, if a restaurant location is pretty filthy, which most of these stop and goes are, shouldn't that be a reason to close anyone with a restaurant license? Shouldn't there be some level of cleanliness required to stay open? Besides the other items that you listed.
And council member, I don't want to send the wrong message. The good retail practices are about the cleanliness of the floor, the cleanliness of the ice machine, the cleanliness of the countertops, whether or not there's mouse droppings all over the place. So it's a combination of those things. Looking at ceiling tiles, missing, dirty ceiling tiles, moldy ceiling tiles, all of that factors into whether or not an establishment is given an opportunity to correct those violations or they're cease operated, and it's a combination. So it's not just one category, it's not just everything else is fine and you have a dirty floor right there. We give them the opportunity because we want businesses to operate safely to maybe, go ahead and sweep that up or mop that up. Now, if that keeps happening, then we know that it's a repeat offender. So it's a very complex matrix of how an establishment is open or closed, unless there's a sewage outbreak or,
Well, I'll say this. So some of the restaurants, stop and goes, not restaurants, restaurants, but some of these stop and goes, I can tell you, are on the frequent flyer list in terms of just being chronically dirty. And, it just seems like any way that we would expect that we could get some help to address the problematic business that it is for the community. We just can't get any sort of motion from the city to say, well, this is something that's a violation, or is this, sort of like the things that we think of as common sense reasons to tell a business that they have to shut down. And clean, don't really seem to resonate with the health department. Have we ever thought about doing like a grading system? Like a grading system, like in some cities where you'll walk into a restaurant and it'll say this restaurant was inspected and it's an A, or this restaurant was a B or C. And you can decide if you want to go into a C restaurant or a D restaurant, or whatever. But you have the information up front as to how this particular restaurant was ranked.
Sure. So, and I want to kind of separate out the notions and the challenges that we have with these businesses that operate as stop and goes, right? Those businesses, and addressing enforcement with those businesses, a grading system would not fix that, okay? And I know that the health department, along with other departments, is working with your office specifically to address some of these issues as nuisance businesses and fold those in. I know that we've been working with your office to provide information about inspections on varying spreadsheets and all of that, and there are businesses that use the loopholes to continue to open and operate. But as far as the inspections go, we do have to allow folks the opportunity, regardless of where they're located. If we're going to offer an establishment that is an eatery, I don't know, Center City Eatery, that option to fix a violation on site and continue to operate or cease operate for 48 hours, we have to afford the same opportunity for other establishments.
When we issue violations with hefty fines in the city, let's say if I park my car in a bus zone now, right, I'll get a hefty ticket, and I don't get due process. Like, it's kind of like the ticket is the notice, and that's the due process, and you have to pay it or else. So, whether it's that, or whether you put your trash out early, or whether you get a speeding ticket, or whether you get a violation because your grass is too high, you get that ticket and you have to pay it. You don't get due process. You don't get a warning first. You just get the violation, and you have to address it right away. So I don't understand why this particular type of business, if you do construction and you're out working without permits and L&I comes across you, you have to stop. They issue a stop work order. But, we have this thing with certain businesses who are afforded a level of due process that works against the needs and wishes of the community, and it's like, well, we need to give them a chance to get themselves together. And it just really feels quite unfair.
And council member, we take each of those businesses and we cease operate them, and when we cease operate them, they get the opportunity, just like when we get an opportunity to pay a parking ticket or pay PPA to untow our car or what have you, they get an opportunity to fix the violations, and they're then allowed to open up. The stop and go issue is very complicated because it also involves the Liquor Control Board and others. And I know that for years now, we've been trying to work on this. I'm hoping that in this new role, that we can figure out additional creative opportunities.
Well, Dr. Nelson, I'll say, like you and I, we worked together for a long time, back when I was the chair of Health and Human Services, and, you're a great partner to work with. But for me, this issue is not complicated at all. And I think for most people, this is not really that complicated. But I look forward to continuing to work with you and hoping to, push past where we are right now to really get the level of enforcement that I think people really want. Well, let me ask one other quick question, because I know I'm a little bit over time. Does the City of Philadelphia Health Department do anything in terms of organizing our regional health providers into some sort of a network? So I know like in some other cities and some other states, there actually, I can't remember if it was Florida or Georgia or somewhere down south, where it's kind of like mandated that they have to meet, coordinate, talk, just so that they are all working on the same page together. There's not a duplication of services. There's, just more efficiencies. So I wanted to know, I don't think that the City of Philadelphia does anything like that, so I wanted to encourage that. And actually, I think it should be a regional network of health providers, because now we have what's happened with Crozier, Chester closing down, and Taylor Memorial. People out there need health care too. It's not, it's not a next door neighbor, but it's close enough that, listen, if you're in Chester and you're pregnant, you still have a baby that's coming on the way, whether Crozier is there or not. So how are we working to make sure regionally that this region is stable medically, and to address some of the health disparities that have been existing for a very long time, which is quite shameful in the city of eds and meds?
Sure. So we're working, a lot of that work is led by the State Secretary of Health, and we're working with our local hospitals, as well as like with the items or the issues happening with Crozier. We work with our local counties, municipalities. I work with the Delaware County Health Director, which is a brand new position. They didn't have that role before. So we are working together. These are kind of newly formed or differently formed relationships now, because they were forged and formed due to COVID and other things. So now we're coming upon other areas where we can communicate and collaborate. So those networks are there. I'm not necessarily sure that they're mandated, but they're in existence, and we do work with them.
Okay. I would just like to say in closing that I hope the City of Philadelphia doesn't just work with them, but leads them to what we need, because I think left to their own devices, good people, but the disparities have continued and grow. So,
sure.
Thank you. Thank you, Mr. President.
Thank you. As there are no more questions from members of the committee, we want to thank all of you for your presentation. Continue to keep up the good work, and thank you very much.
Mr. President, can I say one thing?
Sure. One second, everyone.
Just very quickly, I wanted to take this opportunity to thank you and the council for just all of your support for the department and your partnership and working hand in hand with us to make sure that Philadelphians thrive. Majority Leader Gilmore Richardson earlier acknowledged my team, and I just wanted to echo that and say I think that this is the most fantastic group of professionals that I have had the opportunity to lead on the television and sitting right here behind me. So thank you all so much for the support.
Thank you. Keep up the good work. Thank you. At this time, the chair recognizes Majority Whip Councilmember Thomas for a motion at the public hearing and meeting on the bills and resolutions before the committee today stand in recess until Tuesday, May the 6th, 2025 at 10 a.m. All those in favor signify by saying aye.
Aye. So moved, Council President. So moved.
It has been moved and properly seconded that the public hearing and meeting on the bills and resolutions before the committee today stand in recess until Tuesday, May the 6th at 10 a.m. in room 400, City Hall. All those in favor signify by saying aye. Those opposed, the ayes have it. This motion carries, and the committee will stand in recess until Tuesday, May the 6th, 2025 at 10 a.m. Thank you very much, everyone.